Good afternoon and welcome to the January 12th, 2021 Board of Education meeting. At this time, I see most board members. I can't see Tracy due to me being in my house due to compliance issues with COVID-19 protocol. So I'm just going to do a roll call just to make sure everybody's there. Mr. Johnston,
Present.
Mr. Carroll,
Here.
Ms. Zukowski, Ms. Sessoms,
Here.
Ms. Andrews,
Here.
Mr. Wooten,
Here.
and I'm here. So we have 6 board members here, and I believe Ms. Zukowski will not be present for a closed session. So at this time, Ms. Weckeser, we do have a quorum. We have 6 board members present. So I'll ask for the invocation to be done by Mr. Wooten, followed by the Pledge of Allegiance by Mr. Carroll.
Hey, Ms. Zukowski just came in the boardroom.
Okay, let the record state that all 7 board members are present.
Hey, we stand, please. Heavenly Father, we come before you, dear God, just give you all the glory for letting us be here today, dear Lord, and the business that we have to attend to, dear Lord. I just ask you to bless each and every decision, that we make decisions that are pleasing in your eyes and decisions that will help students. Dear God, I pray for the sick. I pray for all of those that are helping the sick, the warriors that are in the hospitals and the doctor's offices and at homes looking after and tending to the sick in body, dear Lord. I just ask you to heal them and work through the doctor's hands and heal their bodies, dear God. And just be with us today as we make important decisions for students, dear Lord. And I just clear our mind of anything outside of this boardroom that we can make good decisions, and we're careful to give you all the praise, and let us show our love that you show for us to others in this time. In Jesus' name we pray. Amen.
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, I will entertain a motion to go into closed session for the stated purpose on our agenda.
So moved.
Got a motion by Mr. Wooten, second by Mr. Carroll. Start roll call. Mr. Wooten,
Yes.
Ms. Andrews,
Yes.
Ms. Sessoms,
Yes.
Ms. Zukowski,
Yes.
Mr. Carroll,
Yes.
Mr. Johnson,
Yes.
and I vote yes. Motion carries 7-0. We'll now enter closed session. And welcome to our Johnston County Board of Education meeting for January 12th, 2021. Just a brief statement before we get started. In compliance with COVID-19 protocols, I am conducting the meeting from my home tonight for the safety and well-being of all parties that are involved. The rest of the board members are in the boardroom, as well as some others joining us on Zoom tonight. But before we get started, I just want to take a moment of silence and just remember Mr. John Crow, who is coach and teacher at Swift Creek Middle School, who passed away over the holidays. We just want to remember Swift Creek Middle School as well as the Crow family during this time, and keep them in our thoughts and prayers. So thank you for doing that. And at this time, I'll turn it over to before we do that, I'm going to start with adjustments to the agenda, starting with Mr. Wooten.
Mr. Chairman, I'd like to remove topic 9C2 on the agenda, which were, it was Chromebooks for Thanksgiving school. We'll bring that back in our February meeting.
Okay, thank you, Mr. Wooten. Miss Andrews. Miss Sessoms.
None.
Miss Zukowski. Mr. Carroll.
None.
Mr. Johnson.
No adjustments.
Okay, and I have none. So I'll entertain we got a motion for the topic 9C2 to be removed from our agenda, and it will be brought back to us at our February meeting. I'll entertain a second. All right, we have a motion and a second. At this time, I'll start with a roll call, starting with Mr. Johnson.
I vote yes.
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 Mr. Carroll. Okay. Ms. Zukowski. Ms. Sessoms.
Yes.
Miss Andrews.
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0. At this time now, I'll turn it over to Dr. Bracy due to some time restraints with some of our guests.
Thank you, Mr. Chair, members of the board. If there's no objection to the board, I would like to move up COVID-19 updates, which is 9A2 to right now. We'll start our meeting with that if there's no objection from the board. We have some visitors who have to present and have other obligations this evening. I'll start, Mr. Chair, members of the board, with Dr. Kanisha Zimmerman from the ABC Science Collaborative, and just a little bit of information about the ABC Science Collaborative. It's a program that pairs scientists and physicians with school and community leaders to help understand the most current and relevant information about COVID-19. The program helps school leaders make informed decisions about returning to school using the data from their own communities. The ultimate goal of the program is to keep teachers, children, and their local communities healthy and safe. And I will introduce Dr. Pearson once Dr. Zimmerman is finished. Dr. Zimmerman.
Thank you very much, Dr. Bracy and members of the board. Happy certainly today to present information. Unfortunately, I can't see the slides very well. I wonder, I'm happy to do what you would like to. I do have a copy of the slides here. It's a little bit difficult to see from your view. Is it possible to get the slides on the main screen? If not, that's totally fine. But
We see it on ours, Dr. Zimmerman. You don't see it on your screen?
I don't.
Miss Michelle is going to drive the presentation for you. Can you just look at your copy that you have with you,
Sure.
Dr. Zimmerman? Can we do it that
Absolutely,
way?
that's no problem at all.
Thank you.
So I'm Kenesha Zimmerman. I'm an associate professor of pediatrics at Duke University. I'm trained in internal medicine, so adults as well as in pediatrics, and I practice in pediatric critical care. At this point, I've had the experience of taking care of both children and adults with COVID-19 disease, and very happy to be here today. Next slide, please. So as Dr. Bracey mentioned, really our goal here with the ABC Science Collaborative is to make sure that people have the most relevant information to help make decisions. We do not make decisions for people. We don't make recommendations, but we certainly make sure that people have data and are doing this based on data. Our team consists of a number of people from Duke University, Duke Clinical Research Institute, as well as the University of North Carolina at Chapel Hill. We are funded by the National Institutes of Health. Next slide. Oh, sorry. Thank you very much. With the people there. So a wide variety of people that are involved in our team, infectious disease specialists, etc. Next slide, please. Our job really has been to help answer pressing questions from parents to teachers and principals and superintendents to make sure that they had the relevant information to move forward. Next slide, please. There are 3 aims to the ABC Science Collaboratives to make sure that people have the relevant information. The first is really informing evidence-based decision-making, and that is serving as a superintendent lifeline, answering questions. We've certainly been on call for superintendents throughout the course of this pandemic. We've coordinated with the state and local health departments and have a good partnership with NCDHHS, and also have had some partnership with the NCAE as well. In the middle pane here, you see that we have collaborated and created a number of educational resources that are publicly available that answer questions from like, why do we have to mask, to like how far we should actually be away from a person when we're outside. And then finally, our goal is really to advance public health. And so we have a mobile application as well as a case management tool to help schools and districts really have a very clear line of sight into what's happening in their schools and the ability to answer questions related to that. Next slide, please. Over the last several months, we certainly have learned a lot. We have learned that following the NCDHHS toolkit, as well as the 3 W's that are clearly laid out within that toolkit, and a couple of principles have made it have made people really successful in moving back to the in-person learning environment, which I know that you guys have already been there in the past. Some of that is related to transparency, having plans, following procedures, making sure people are adhering to the mitigation strategies, and making sure that you're thinking about things like extracurriculars and as well as the arts, or thinking about going slow and then moving and ramping up. People have certainly been successful in doing that. Next slide, please. And then one more slide, please. So we have a number of districts with whom we are engaging, 48 across the state, and these are just list a few of them. Next slide, please. They're the traditional public schools as well as charter schools. Next slide, please. So over the last several months, we've learned a lot of information not only about schools, but about COVID-19 in general. What we know is that plans and protocols work. Many of you might have seen the Swiss cheese model before. The Swiss cheese model really is to put multiple layers of protection in place, and you guys have practiced this already back in the fall. But thinking about things like physical distancing, masking, washing hands, ventilation, contact tracing that's going to be rapid and dependable. These types of things allow us, these types of things all put in a row, allow us to not have holes that might allow infection to slip through. Next slide, please. There are lots of learnings from across the time of the pandemic. Early on in the pandemic, the left-hand panel here, we had our first information about child care centers or those types of settings. There was an initial article that came out in the CDC's journal, which suggested that there could be transmission from children back to their parents when they went home. These are kind of preschool type of settings. And looking more closely at that data, what we found out, however, is that those children didn't get it from each other, but they got it from the staff member that was working. And those staff members that were working either were symptomatic coming to work or did not have or had a person who was sick at their house as what we're calling index cases. In those settings, there were not masking in place. And so we then learned that things could be transmitted if those plans and protocols were in place. However, if you look at the middle panel here, you can see that secondary transmission is not a given. When you looked later in the pandemic, the Rhode Island Child Care Centers, there were about 66 programs that were involved in this study. There were about 20,000 students and staff that were involved in this, and they had no evidence of confirmed secondary transmission. There were 17 cases where there might have been secondary transmission, but all of those would have occurred in the setting where there was known breaks in protocols. So the takeaway from that is cases in the community will mean some cases in schools, but it does not necessarily have to mean that there is secondary transmission or spread within schools, which is the gold standard for how schools are actually doing. And then finally, on the far right of this screen is kind of a general community example of things that you've probably already heard of as well, published again in the CDC's journal. We know that masking works, and one of the ways that we know that masking works is there were 2 hairstylists who didn't know they had COVID-19. They had a policy within their building that they needed to wear masks, and their clients were wearing masks. They serviced hundreds of people over the course of several days while they were infected, and yet none of these people actually were infected. And if you've ever been to a hairstylist, you know how close you can become in those types of settings. So this is the type of information that suggests to us that the plans and protocols work. Next slide, please. So then we're moving more specifically to schools. So what have we learned about schools? In October, there was a publication in The Atlantic that looked at about 200,000 kids and looked at some staff members as well from 47 states, so spatterings across the states there. But in that setting, they found that the infection rate among students and staff were very, very low. At the time, there were questions about whether or not sending people back to school actually increased the community transmission rate. And this publication, which compared the community transmission rates to what was happening in schools, the rates within schools, suggested that schools were not the major factor here, that schools were not driving the community transmission. And so this was good news for people who were interested in going back to school. Next slide, please. That was conducted in a setting across the country where there were high prevalence areas and lower prevalence areas. And so we got kind of a mix there. And looking at other places across the country, the message is quite consistent. So looking at the UK, published in November of 2020, they wanted to see what was happening within their school buildings. They looked at both students and they looked at staff. They had almost 12,000 participants here, and they had some high prevalence settings and they had some low prevalence settings. And they wanted to calculate the positivity rate for COVID-19 within their particular population. Next slide, please. In that setting, they again found that COVID-19 was remarkably low, and this was repeated in New York schools when they did testing among those schools in New York. But 1.24% of people attending schools or in the school buildings had COVID-19. So this is quite low. Next slide, please. Looking at other settings, Norway. So they wanted to look specifically at transmission. So one of the big criticisms has been, you haven't done testing, people haven't done testing, we don't really know what's happening. And so in this setting, they were looking at K through 12 schools in August and November of 2020. The important part here, as in the UK, is that there was no masking requirement. They did have some physical distancing. They did have some hygiene measures, but they did not mask in this setting. They had a moderate community transmission rate, obviously lower than what we currently have right now. And over time within the community, they saw increasing incidence within the community of those 5 to 13 years of age. They did prospective testing of contacts. So when they identified people within the school setting who had positive cases, they did their contact tracing, which is very, very robust, and they tested all of these people twice per week. Next slide, please. Here they saw that there were 13 cases, index cases, so they derived from the community. In all but one case, there was someone at home who had already been infected. And then there were a number of people who had to quarantine and they did contact tracing. So they had almost 300 people that they were looking at. They found no cases of secondary transmission among this population, reinforcing the idea that despite the fact that they didn't have masking, transmission within the school building was low. Next slide, please. So then, people continue to ask questions about the United States. We continue to have increasing amounts of data from the United States. A recent study that was published from Mississippi, again, that was kind of led by the CDC or researchers in Mississippi, but was published in the CDC journal, looked at whether or not kids who went to school, did they have higher rates of COVID-19 infection compared to those who did not go to face-to-face learning. This population was less than 18 years of age. There were almost 400 participants. This is what we call a case control study. So they looked at those who were negative and those who were positive. There were 55% non-Hispanic Black in this particular population. And what they found is that in-person school did not increase the risk of having COVID-19. In fact, the things that did increase the risk are things that you do in the community, like funerals and weddings and play dates, et cetera, which people were doing. Next slide, please. So then there's data that we've gathered over the last several months from North Carolina schools. We looked specifically at 11 districts who were involved in the ADCs who were in Plan B. They were in Plan B from August to the October timeframe. They had people coming 2 days a week and then switching up, the cleaning day on Wednesday and switching up on the latter parts of the week. We ended up looking over 90,000 staff and students. And at the time, during this time of the study, there was pretty wide variation in local transmission. So 200 on average, if you take all of these counties, there were 200 to 400 cases per 100,000 residents over a 2-week period. There were, however, some counties during the study period that had community transmission that was as high as 900 cases per 100,000 residents over a 2-week period. What we found is that there were 773 cases that were identified within the school buildings, and they were determined by public health to be community-acquired infections. They did their contact tracing, they talked to people, they tested people, and they found 32 additional infections that they believed were acquired within the school buildings. So this is called secondary transmission. There were no instances of child to adult transmission of SARS-CoV-2. On the right just tells you a little bit about what was happening within the counties, what was happening within North Carolina at the time, and what was happening within the study districts with regard to infections per 1,000 people. Next slide, please. Some of those, we have data on Plan A from some of those districts. We have 6 districts in which we have data. This was from the mid-October through the Christmas break. We captured about 40,000 staff and students, and we saw 14 cases of secondary transmission. So this is very much on par with what we saw in Plan B for the 11 districts, despite the fact that we all know that community cases were rising at that time. These districts continue to be involved in having people in face-to-face education within their counties. They are seeing rates in the upwards of 1,500 cases per 100,000 residents over a 2-week period, and are still being successful in preventing secondary transmission. In the cases, just as in Plan B, when we did see secondary transmission, someone could point directly to people not masking, a certain situation where there were pre-K people not masking, period of pandemic fatigue, et cetera. There was clear evidence that not following protocols was the reason that this led to secondary transmission, not because there were 1,500 cases within their community. Next slide, please. So the take-home points from this, all of the data here, and all of the data is remarkably consistent. I mean, in any epidemiologic study, you want to take it with a grain of salt. But as information builds and builds and builds, the story becomes increasingly clear. When there are cases in communities, there are going to be cases in schools. That is going to be an expectation because schools simply reflect what's happening within the communities. However, cases within the communities does not necessarily translate into cases or spread within schools. So cases within schools do not translate to spread within schools. With mitigation measures in place, and that's including the Strong Start school, toolkit, that's including the 3 Ws, that's making sure you have transparency and following data. In school transmission, which is the most important and relevant marker, is rare. Even when cases in the community come into the school buildings. There is some data that is available that also suggests that when there is evidence of secondary transmission, overwhelmingly it's happening from staff to staff and not student to staff. And then metrics based on what's happening within the school community are going to be most important. I've said that a lot of times, but it's going to be more important than what's happening outside of the school walls, over which you have no control. And I think the reason people have been successful is because schools are very used to influence or to implementing policies and following rules and procedures and leading by example. This is why people have been successful, and this is why you guys have been successful as well. Next slide, please. So another strategy, obviously, in helping to get back to school is immunization. And I just want to tell you a little bit about what we know about immunization, at least as far as the timeline and what this may look like. Next slide, please. So we all know that we are entering kind of the phase 1B, and that's where the educational sector is included. We are still vaccinating healthcare workers in 1A, but we certainly, in some places, we do move to vaccinating greater than or equal to 75 years of age this week. And then UNC is planning to do it, I think, next week, or sorry, the week before, and then UNC started this week. And that's happening kind of across the state. This is certainly a moving target, but the goal is to vaccinate those greater than or equal to 75 years of age. And then they would then move to people who are more frontline or essential workers who are greater than or equal to 50 years. And that would include teachers. In the healthcare setting, the people who were in face-to-face education or face-to-face with people with COVID, those were the people who were prioritized. Obviously, there are a lot of healthcare workers, and some of them see patients and some of them don't. So the ones who saw patients were the ones who actually got vaccinated first. I don't know that that will be the case with regard to schools and vaccination of teachers, but that's how things have gone in other settings. And then following that, it'll be healthcare workers and frontline essential workers, really of any age. Next slide, please. I should say, actually, in thinking about the vaccination schedule. So as you know, we are behind schedule. I was in part of a meeting today in which we talked about what it would take really to get vaccination up to par. We would, in looking at the numbers and the number of people we have here in North Carolina, and to get to about 70% of people vaccinated, we would need to vaccinate about 41,000 people a day for the next 9 months. We at the moment are nowhere near that. The other thing to really keep in mind is that children, there is currently no approved vaccination for children. Children, there are studies that are ongoing right now. I know this for sure because my daughter was part of one. This 12 to 15 years of age, this was a Pfizer vaccine. So that study is ongoing. Hopefully those results would come in the next several months, but they would need to go through the FDA process. With regard to younger children, we wouldn't expect to even see those kids in trials until the late spring. So the expectation is that there would not be a vaccination that would be available for children in the beginning even of the 21-22 school year. We're certainly looking at, into 22, into the latter part of the 21-22 school year before things are kind of moving in that direction. And then there's, certainly questions about the new variants. Should we be worried about the new variants? What we know is that SARS-CoV-2, the virus that causes COVID-19, is a mRNA virus. mRNA viruses, they mutate. They don't have the proofreader protein to catch themselves when they are replicating. So mutations are very common. Some mutations make this more transmissible. Some mutations make things less transmissible. And this is just a factor of respiratory viruses. There's recently described variant B117 that has been of concern from the UK. There are concerns for increased spread and false negative results associated with this. And the thought is that perhaps it is more able to kind of attach to cells and enter cells than the prior variant. However, fortunately, to date, there's no evidence that this variant causes more severe disease. So no more hospitalizations, no more deaths, none of those things. Just perhaps is able to transmit more easily. The other really good news, however, is that there's no evidence that things like masking, distancing, hand washing, surface cleaning should not work. So these things are still going to be increasingly important as we're moving forward. And the other really good part is that vaccines should be working against this. And the preliminary data suggests From Pfizer, there's been some that's come out, suggests that that is the case against mutations, that the vaccine is in fact working. Next slide, please. I believe that's our last slide. I noticed that my colleague, Dr. Akinboyo, is here. She is head of infection control and pediatrics at Duke University, and we are both happy to answer any questions that you have.
Dr. Zimmerman, I just thank you for providing us this information. I think it's very helpful when we're making decisions based upon the, our school setting and things of that nature. And but I just appreciate your time tonight, bringing us this information for us to think about as we have further discussions on how we're going to proceed in Johnston County.
Doctor, did you have, you might have covered in the slide, spread from staff back to children. Did you have any data on that?
I'm sorry, did you say staff back to students? Let me think through. I did not present that information. Certainly did not present that information from North Carolina because as you know, the biggest concern has been students to staff. There is some data in the UK where there was no evidence of, or there's no masking, low prevalence setting, 55 outbreaks in that setting. 26 of those outbreaks occurred staff to staff. 16 of those outbreaks occurred student to staff. And then 8 of those outbreaks occurred student to student. There was very little transmission, I believe, between staff and student, staff to student, if that makes sense. Dr. Akinboyo, I don't know if you can recall any other information there. There are certainly cases. We certainly know that it can happen. The Utah example is one of the examples that comes to mind about the possibilities where there certainly were no masks there. But the overwhelming issue is with staff to staff.
Yeah, I would agree. Good evening, everyone. I had to join late as I had a conflicting meeting. But what our data and what other centers have shown, so some of them are childcare or daycare settings and some of them are school settings, has suggested that there is very little child to adult spread. And also, I think there are fewer cases of adult to child spread, although it can occur. Highest risk has always been adult to adult or staff to staff. And this is also what we see in the hospital setting. When we think of patients to staff, we see more cases of staff to staff spread as compared to patients to staff.
Any other comments for the ABC Science Group?
If, in summary of what, and help me if I'm wrong here, to either one of the doctors, if community spread is taking place in a community, if protocol are followed within the schools, as they should be followed, and those things are listed, you've talked about some, your feelings of spread within the school are that it would occur at a very low rate?
That is correct. That is what the data overwhelmingly suggests, repeated study after study, whether you're here, whether you're in UK, Norway, whether it's now, or whether it's, back in August. The data is consistent with that.
Any other questions?
Looks like no more questions here, Mr. Sutton.
Okay. Thank you, Dr. Bracy. Thank you for your time tonight presenting us this information as we move forward, looking at the decisions we're going to have come about here in a few minutes. But we do appreciate all the information you provided us and the data that went along with it. So I know you guys have another meeting to get to, but we do appreciate your time.
Thank you very much. Take care.
Thank you. Dr. Bracy, is Dr. Pearson here?
She is, Mr. Sutton. Just want to welcome Dr. Pearson here to our meeting. Dr. Pearson, certainly we thank you for the great partnership that we've had with you.
Thank you. Have to be sure I know what I'm doing here first. Yep, okay. Well, good evening. Thank you all for having me. Can everybody hear me pretty well? Great, thank you. Thank you again, Dr. Bracy, for your partnership, and particularly Dr. Pearson, Dr. Allen, who've been immeasurable in all of the support that they have provided with us as we work with the school system here in this response, in this outbreak. So I just wanted to present a little bit of data to you all. I know you have some decisions to make. I believe you have the CDC indicators and thresholds for risk of transmission of COVID-19 in schools. So a lot of the data I present, you can look at the data that I am presenting and look at, what is the risk for transmission in our schools based on the CDC indicators here, okay?
Will this copy of your presentation be available to us?
Yes.
Thank you very much.
So again, this is just a slide that talks about these indicators that the CDC looked at, and I wanted to be sure that you all had this, because you all are making these decisions for, of course, your students and your staff here. Core indicators, you would look at number of cases, and that's per 100,000 population, our percent positivity rate, and the ability to implement school mitigation strategies. And I think our school system has been doing a great job with those things. That's those 3 W's we talked about. In addition to cleaning and disinfecting and contact tracing, and we're working pretty closely with your team on contact tracing and case investigation. And then those secondary indicators have to do with cases, but a lot of the hospital, inpatient bed use, ICU capacity, and then what's happening in our community. Next slide, you can't really see very well, but this is actually our data from yesterday. We're up to 13,513 cases. And as of today, it was, before I left, about 13,610. So just to give you an idea, we were at 127 deaths yesterday and had 4 additional reported to us today. Hospitalizations, we're at 82. And that's any Johnston County resident that is hospitalized, not just in our hospital here, but anywhere else in the state. And you can see, you can't, but you'll have this. It's pretty small, sorry about that. The largest group with our cases is that 25 to 49 group, but that 0 to 17 is about 14% of our cases. I did ask my staff to pull out that 4 to 7 group, and we're going to look at that in just a second. That's about 12% of our cases, the 4 to 17 group. Excuse me. I'm good. Can you hear me now? The 0 to 17 is about 14% of our cases. And when we look at the 4 to 17, it's about 12% of our cases here in our county, okay? The largest group is 25 to 49, and that's about 40% of our cases that we look at. That next slide is the number of our cases per month, and you can see we had a significant spike in that December timeframe. And we expect, of course, with the holidays, we've got a couple of more weeks, we'll expect that spike to continue. Those January numbers, of course, is just January 12th. And so that's why that number is there with the 1593. So we've got the rest of January for our number of cases that we're going to have. So we expect, we had that December spike with the holiday. We expect another couple of weeks before we see this New Year's spike. So we keep looking for that and know that that's continuing and will be coming. The total, 4,073. The next slide is just cases received, and we try to do a count there by week, so we're just looking at that per week. But you can see there's some, early on, of course, we didn't have that many cases. It continued to go up. You can see us climbing that mountain and that hill there, and our cases are continuing to climb. This next slide, I'm sorry, it's small, but this is the data looking at the last 2 weeks. So you can see what's been happening since December 29th with our cases. We were at 11,511, and then yesterday 13,513. And then you can see our deaths have increased from 103 to 127, and our hospitalizations were 73 in December, decreased a little bit January, but back in the 70s again. These are our hospitalizations and deaths, and our deaths have been doubling since September, more than doubling. So you can see that we had 5 deaths in that September-October range through October, 9 November, 16 through the end of December, and as of January 3rd, we were at 35. Same trend in our hospitalizations here in our county. This is that 4 to 17-year-old group that I talked about. The total number of cases in age 4 to 17-year-olds is 1,597. When we look at the 4 to 11, it was 723, and 12 to 17, 874. And those cases have continued to increase each month, just as the others have from September to October. September, October, November, and December, sorry. And this is our positivity rate, so I wanted to give you an idea of what's been happening. You can see at the beginning of November, about every 2 weeks, how our numbers are increasing here. This test positivity rate looks at number of positive tests from PCR over the whole county. Right now, we're performing 5,000 to 6,000, at least 5,000 to 6,000 tests a week here in our county. And so this positivity rate is the number of positive tests that are coming back in all those tests. November 1st, it was at 8.4. You can see at the 29th, it was up to 12.5. End of December, it was 17, almost 18%. The current, that is today, so if you go to the state website, the North Carolina DHHS dashboard, they're doing a daily positivity rate, so you can watch that, but it's 16.1. And then I usually get a weekly report from the state so that I can see what the data looks like, how many total tests have been done. I usually get that on Wednesday. But we're staying in that 16 to 17% range for now. I think so. You know, over the holidays, there wasn't as much testing. We have 2 days that our partners are testing right now in Smithfield, Tuesday and Saturday, and we've asked to add another day. Demand is pretty high. They said they're doing between 300 and 400 on each day that they're there. And then, of course, we have partners who are doing testing in some doctors' offices, et cetera. So I think, you know, in the 5,000 to 6,000 range, that's a good bit of testing that we're doing.
I'm curious, how much more testing are we doing now compared to 9 days ago?
9 days ago?
90 days,
90 days ago? Sure. We were at about 3,000 to 4,000.
Okay.
Mm-hmm.
Now we're doing
5,000 to 6,000. Yes, sir.
double the amount of testing.
That's correct. This is, right, about 50% more. This is our hospital data, and that's data that, you know, we need to consider when we're looking at community spread and what's happening in our community. Our hospitalizations have been doubling since September. Our hospitals, Johnston and Clayton, are averaging 9 to 12 new COVID daily admissions each day. Currently, they have 13 ventilators in use. They've been keeping me updated daily. 11 of those are COVID positive patients. So just to give you an idea there. Our hospital is licensed for 199 beds, so it can give you an idea of the number of patients there. And they were at 55 COVID-positive patients today. So about a third of all the patients they have in the hospital are COVID-positive at this point. This morning, they said both of the ICUs were full, but they did have a few med-surg beds in Smithfield open.
I'm assuming that they would have staff if they needed to put COVID people in med-surg.
They would, but if they had to surge and open additional beds at this point, they do not have staff for that. Staff is the issue for covering additional beds. When they don't have beds, they're holding patients in the ED. And so they are using travel nurses and other staff. But of course, as you can imagine, the demand for them is high everywhere. So it's hard to get them at this point.
And ventilators, we got plenty of ventilators, is that an issue at hospitals?
They have ventilators, so that's not an issue at this point, but it would be staffing that would be an issue. That's correct. That's correct.
You can ask a question?
Oh, yes, I was at questions.
Oh, okay. I think I saw this, but I don't remember the number. Out of the, you said we have had 13,000.
Mhm.
13,513 cases. How many are considered recovered?
Sure. Let me see if I have that number here. Oh, I don't have it here.
I think it's on your,
It's on my dashboard.
Yeah.
If you go to the dashboard, but I did not print out my dashboard for today.
We're having more deaths. We're having more deaths, but is our death percentage not advancing, or is the percentage according to the number of cases per one, or, whatever 100,000 they're doing, is the percentage creeping up, more people dying per 100, or is it staying about static?
That number is increasing. When you're seeing, of course, 10 versus 35 deaths in a month, that number is increasing per 100,000. The hospitalizations is the other concern, of course. When you have so many COVID patients in the hospital, you can't take care of the other things you need to take care of, heart attacks and et cetera. So that's an issue, of course, for us. We are, of course, one of those counties that's red, but almost all of North Carolina is red. And in addition, the White House, I get a White House task force report every week. And we're one of the top 12 counties on that White House task force report that they're looking at in North Carolina because of our cases.
Based on the vaccinations, when do you think we will be vaccinating teachers that would like a vaccination? When will we have that ability and the doses available?
It's difficult to answer that question because we don't know how much vaccine we will have, and we're only informed of our dose for the next week, the week before. So I found out, for example, on Friday I was supposed to get 1,500 this week. So once a week they are telling me how much vaccine I got. The first week we got 1,000 doses. The second week we got 300 doses. The third week we got 100 doses. This week we got 1,500. So it's difficult to know when we will get to the point where we will be able to get to our educators and those other essential workers. I can tell you that, right now we're doing that 1A group, the high-risk healthcare workers, long-term care facilities, and 1B, 75 and older. That 75 and older group, we have over 10,000 of them in our county. So if I get 1,000 doses, we're going to be doing this for a while. We're hoping that more vaccine will be released, not just to health departments and hospitals, because that's who has the vaccine right now, but to other providers. Medical providers and pharmacies, so they can assist with this. But much of what we do and how long this time frame will last depends on how much vaccine we get.
And the other problem I think we're going to face is there's a second dose that has to be given.
That is correct.
So we're looking, and we're using Moderna.
That's correct, Moderna, and that is 28 days.
So 28 days, we've got to have enough vaccine to revaccinate who all you've done to that point,
That's correct.
plus hopefully have more to,
Start new
Yeah.
doses. That's right, first doses and second doses.
And Dr. Pearson, in between the first dose and the second dose, just because you have the first dose doesn't mean that you're in the clear. You have to still take precautions and.
That is correct. And even after the second dose, that, everybody heard about the 94 to 95%, efficacy rate. That is actually 2 weeks after that second dose is when you see that. So the first dose, you get the first dose, the second dose is a booster to improve that efficacy rate. So you really need to have both as much as you can so you can get that 94 to 95% efficacy rate.
And again, that does not kick in until 2 weeks after the vaccine has been administered.
Correct. And it's still, you need to continue with the 3 Ws and all those things that you're doing. They are still doing studies to see how long the immunity lasts, so we don't know that for sure at this point. These are very new vaccines. So we still need to continue with all the mitigation measures.
now the variant strain, I believe I read in the paper where we haven't seen it in Johnston County yet.
We have not, and we've not seen it in North Carolina. Our state lab sends samples to the CDC. They talked about it on a health department call. They've increased the number of samples they're sending. So we have not for sure seen it in North Carolina. We expect it's here. We just hadn't seen it yet in the test we've done.
And there's a difference in transmission rate, I think. Is that right?
That is correct. It seems to be more transmissible. When we talk about viruses, we talk about, we call it an R0. That is, how many people can one person infect? And so we want that number to be 1 or under. And right now, the R0 is about 1.6, 1.7 or so. But it looks like this new strain, it's more transmissible, even 2 times more. So that could be the issue. You would have more transmission. As the previous presenter said, it doesn't seem to be any difference in the progression of the disease, et cetera. It's just that it's more transmissible, which means more people will be infected.
And are they seeing yet as to whether or not the new variant is affecting the different age populations like the current variant is?
They have not.
Dr. Pearson, as always, I appreciate your information, but more importantly, I appreciate you assisting us since day one of this COVID-19 hitting our county, and all of the back and forth communication you have had with Johnston County Public Schools, and it continues today. I really appreciate all of your expertise in the medical field, as well as what you bring to Johnston County Public Schools. We just can't thank you enough for being a strong advocate for us, but also being only a phone call away when we have certain situations dealing with COVID-19. And we value and respect your input.
Well, thank you all. It's been a great partnership. I know that you all know we were at West Johnston High this morning. And it went very well. So we appreciate all that you all have done, David, and all the school system employees. You had nurses and social workers out there helping us, so that was great also. So this partnership has been invaluable to us. Thank you.
May I ask you one more question?
Yes, sir.
The peak or the spike that we're looking for New Year's, we're looking at late March, late February, early March.
Yes, we're going to see probably in the next couple of weeks an initial spike or so from New Year's. But when you look at what's happening in our community and even across the state, that expected peak is expected to continue through February and early March.
Do we expect it to even be higher than it currently was? In other words, as we add to that peak, it might drop between now and, say, February the 10th, but once that peak starts back up, Is it anticipated to be a higher peak than the Christmas peak?
I don't know that I've seen that. It looks like, from data that I've looked at, it should be probably around the same. Yes, sir.
Which was significant.
Significant, yes. Critically significant when we look at our cases and hospitalizations.
Any other questions for Dr. Pearson? Dr. Pearson, again, thank you very much for your time tonight. I know you have another obligation to get to, but we really appreciate you providing us with this information as we look at this from a county level and make our decisions later tonight. But we really appreciate everything you bring to the table to assist us with those decisions.
Thank you all. Appreciate it.
At this time, Dr. Bracy, I know we're a little bit past 6 o'clock. If we can pause just a second from the COVID updates and go to our public comments. We have 2 comments tonight. One of them is linked to your board agenda that is an online comment, but we do have one tonight speaking to us for public comment that will be in person. We have Miss Stacy Lee signed up. Citizens who have signed up to address the board during public comment will be called upon as they signed up, and we'll have, Mr. Stacy Lee have 3 minutes to address the board. The board suggests that specific personnel or student matters be addressed to the school principal, the Johnston County Public School System official responsible for the program or facility, or to the superintendent, and are not appropriate for this setting. As I said, Mr. Stacy Lee has 3 minutes to address the board. Mr. Lee, the floor is yours.
Thank you. This is a new on the other end of the spectrum. You know my name. I was in education for 42 years in one form or the other. I was in a classroom in control. I was 10 years in Cumberland County in 5th and 6th grade. Then I came back home to Johnston, worked in middle school, and then went to the high school for 16, back middle school. And then I was, so to speak, full-time driver's education, centered in out of Cleveland, but I worked Hope County. My purpose of being here is, I guess your life goes in cycles. I'm still working. I'll be 75 the 31st of this month. And education was a love I had. I've never regretted. Left education, went into Parks and Rec for 7 years. So, but I have I guess you'd say a heavy heart for American education, our education. We're a republic. We believe in the federalist system, and we have 50 republics within the big republic. Then we have 100 republics within the North Carolina, and then we have our communities, which are really republics within. And the grassroots is where the success of this nation lies. I want to tell you how much I appreciate those of you who are giving your time. And I was elected to the board in 4 Oaks for 3 terms, and I know what it takes. It takes a lot. Sometimes dealing with somebody who's upset, that also takes a lot of your time, and I appreciate that. This won't be the last time you see me. Dr. Bracy, I appreciate the time you gave me in August. That was a good conversation. But our nation is in a mess. Our nation is in a mess, and public education has taken its raps. I am for public education, but at this time I'm not against the private schools and the charter schools and the homeschooling. The best way to get it done is to get it done. And I just want you to know that I want to support you in every way I can, but we are really in a mess. And I was thinking that our youth were going off to the universities, which are very liberal now, and they were getting intoxicated with this wide open thinking. And I've changed my mind. I believe that it's not what we're trying to do. It's like teaching. It's not what you teach, but it's what you're not teaching. And I think some of those factors are controlled by upstairs. I'm in with three things. Back in 2006, I was working on the Cabela's project with the Secretary of State, Marshall's office. That day I read in the newspaper, a News Observer, where the Department, DPI, yeah.
I love me some Mr. Stacy.
That's fine.
I do, but I am a retired teacher.
Yes.
I do a liberal fall.
Okay.
So if you.
Time flies.
It does. So if you would kindly leave us your comments.
Yeah.
We'd be glad to read them.
I will do.
Okay.
Thank you very much. Thank you.
Thank you, Ms. Terry, for assisting with the public comments. Dr. Bracy, I will turn it back over to you and your staff for additional updates for the COVID-19.
Okay. No problem. Can everybody hear me pretty good with this mask on? Just we have a presentation we're going to share, the leadership team and myself, with some information that we hope will assist the board as they make their decision. Next slide, please, Ms. Wecker, sir. Just a review, and I'm not going to touch upon all of these things. There's some things that we've done. I will highlight a few. Really want to pivot back to August, when we met as a board and everybody wanted to make sure that the public was well aware of where we were as far as our metrics are concerned. And we sat as a staff and we got Ms. Gill and her team involved, and we created our COVID-19 dashboard, which is amazing and second to none. It's just a great tool. And I'm proud of this district because we've been very transparent on our numbers, our positive tests, whether it be students, whether it be staff, our quarantines as well. It updates every single day. It's a living slideshow. It changes as the day goes on, as people test positive, as people go into quarantine, as people come out of quarantine. So certainly, if you have not had an opportunity, and I'm sure most people have had the opportunity to look at our COVID dashboard, please do so. When you click on our homepage, normally it flashes up, but if it isn't up, you can click the arrows and go straight to there. And then you can get more detailed drill down information if you click on the link for our dashboard. And we'll be glad to demonstrate that later if it's the board's pleasure. These numbers here, I won't really get into because Dr. Pearson covered so much of this. She did a great job covering the status of where we are. Next slide, Ms. Wecker, sir. Thank you. Just summarize what North Carolina is, all the cases, all the percent positive. And she said what we all knew already, in the sense that there has been an uptick in infection rate and cases since we last had our conversation on December 8th. Next slide, Ms. Wecker, sir, please. Just a little drill down specific metrics about Johnston County specifically. We are the 10th highest in the state. Thinking off the top of my head, Ms. Gill, I believe when we first start presenting this information to the board, were we number 6? We were seventh in the state. So we've gone from 7 to 10. But as the state has had a slight uptick in percentages, so have we. We're up since December 8th, up 4.2%. But as Dr. Pearson said, in December, in fact, we were 17% at the end of December. So we've gone down slightly. Next slide, Ms. Wecker, sir, please. This is just a snapshot of our dashboard on where we are now. Currently, total active cases, students are 32, staff are 63. Elementary, we want to break it down by grade level. Elementary, we have 11 students. And total active cases, 25 staff for the elementary level. As far as the middle school level is concerned, 9 students with active cases, 14 staff with active cases. Going to the high school level, we have 12 students with active cases and 16 staff. And as far as our central services is concerned, we have 8 staff members who are currently with active cases. And as far as quarantines are concerned, 301 students are quarantined and 137 staff members are quarantined. Looking at our, back one second, Ms. Wilkerson. Our percentage of active cases for students is 0.15, 1.26. Ms. Gill, I believe is that face-to-face students or is that all students? Just face-to-face students. Thank you, Dr. Pierce. I thought that's what it was. Thank you, Ms. Wilkerson. I asked Dr. Pierce before we left for Christmas and when we made the decision as a board to take a picture of where we are now, and we'll look at it again in comparison to where we will be the next time we meet as a board. And as I mentioned earlier, we had 32 active cases. Compare that to when we left, we had 43 active cases. Just elementary level, 14 active cases in December, 11 active cases today. Middle school level, 12 active cases in December, 9 active cases today. High school, 17 active cases in December, 301 active cases. I'm sorry, quarantines, 1135 quarantines on December 8th, 301 quarantines today for our students. And percent of active cases, as far as students are concerned, 0.20% in December 8th, and now is 0.15% now. Just looking at our staff, another snapshot, active cases for staff in December, that's going up. Was 33 on December 8th and 63 today. Elementary specific, 21 in December, 25 now. Middle school had a significant, I would say, jump, 4 December, 14 now. High school has 5 in December and 16 now. Central Services had 3 in December and 8 now. Staff active quarantines, 270 in December, 137 now. Staff percent of active cases is 0.66% December, 1.26% at this time. So now I'm going to ask Ms. Gill, we want to make sure you have all the information tonight when you make your decision to talk about our facilities, our operations, and communications update on where we are as a district. Ms. Gill.
Right. Good evening again, everyone. And I'm going to try to talk as loud and clear as possible with my mask on this evening. But I'm going to give you a quick overview of where we are in all aspects of operations and communications. So during this time we have been on Plan C, we received a very generous donation from UNC Hospitals, and we have some KN95 masks. We have distributed those to all of our folks who are working out in the field right now. We're very appreciative of that, in addition to the already distributed PPE that we have. Again, we continue to operate normally in our maintenance and critical services such as school nutrition, all of the main areas, transportation that we do as far as our girls doing the routing, ladies and gentlemen. PPE is in reserve. It's ready to be delivered. We are able to get that in. So we do have a delivery plan, but then custodians and or principals can let us know when they are in need of additional. But according to whatever plan we go with this evening, we will certainly make sure that that is in place moving forward. We do still have full-time, temporary, and reassigned other staff who are continuing to clean our schools during our Plan C time, along with general services continuing, and we'll continue to bring up our sanitation spraying effects. And when we talk about the temps, those are those temp service folks that we except for the Christmas break times, had them continue on. And then the reassigned staff are your driver onlys and different folks who need to make their hours, who are working at specific sites. From a school nutrition standpoint, they have continued on. Again, just make sure everybody knows that we do have the opportunity to feed the children free all the way up to 18 years old the remainder of this school year. And we do operate all of our sites. Anybody can go to any high school site and receive a meal. And we say receive a meal for the day. That is going to be breakfast and lunch that we package together. And since March, we have distributed 1.4 million meals. And our Christmas meal packs was extremely popular, and we had 5,000 plus families with that. So Michelle, would you, thank you so much. Technology services, and there's quite a few links here, and I'd like to show you a few of those. spend just a bit of time on this particular slide. The deployed devices, this gives you a summary of what we have put out in the schools, and you will see that from a student total, 26,737 devices, and then the number of hotspots, 4,000, I believe it says 405, and then we break it down by elementary, middle, and high, and then we surveyed the schools to ask what additional supports that they needed to be able to support the remote setups. A lot of these remote setups were when they were able to be in the schools, but again, any of these devices and remote supports they could take with them. Webcams, PC speakers, tripods, headsets, lots of power cords get lost in this whole thing. And then some document cameras that schools already had online, but we have worked with schools to learn how to use the tripods and their phones to be able to flip things, to be able to show them documents. Schools were provided, again, the request forms. Technology services is also provided. We've got 11 parking lots with Wi-Fi in that. And we have school support for our technicians. During the time when our teachers were learning to do their remote setup, we would send our technicians out to assist them with that. And then finally, we have done quite a bit of collaboration with the digital learning team in CIA. And this is our JCPS support page. We call it the bit.ly, but if we'll open that up, that is live. This can tell you all the resources, but go down to the calendar if you'll see the things that's actually being offered and continue to be offered. You can go back and see what we have offered in the past to help support our teachers ongoing and what things that they need. Okay, back, there's also the support in the resources section, lots of different supports and guides for them as well. And then if we go back, we have our technology blog. This goes out. We've subscribed our principals. We can subscribe you to it, and I think y'all would love that. Anything that's hot off the presses that is happening in the world of technology, again, that's a collaboration between the services side and the instructional technology side as well. And then you can go back and look at past topics as well. That goes out to our tech people, media people, teachers can be a part of that, principals, anybody in this district can know what's happening with technology. That's been going on for a very long time, but we have really expanded that focus since we've been in remote learning. So backing up, and then we wanted you to really know and see this document. It's an intense document. All of the LEAs were instructed to put this plan together with the same questions, every LEA, and then we had to send that in July, and then that would assist us as being our guide and where we would want to be as far as instruction remotely. So we had a team of folks, many people in CIA, many people on my team. Dr. Jamie Lanier took the lead on that. But if we just scroll down, this is a wonderful document to be able to help you see where we were going with deployment of devices, as well as the remote types of instructional methods we were working with the teachers on, the supports. And then there are sections that actually talk about how are we going to deliver instruction for our EC children, our ESL children. So I point that document out to you as a great resource that will answer many questions, and certainly we have shared this with our schools. We can reshare and make sure we continue to focus on this thing. But this is our guide that we use to assist us. Going backwards, here we go. The last thing I want to show you about technology is our technology use form. All of these 26,000 student devices and 4,000 hotspots that we've put out, this is our home use agreement. And then we have a hyperlink for the Spanish version of the agreement. And just bring that to you just so you can see that's our way of knowing what we have checked out. And when we check it out, we also check it out in our asset manager in Destiny, so we're able to see what we have and be able to track it. All right, moving on. Communication. We have a section of our website that is the technology help section, and that is a triage of who you call, what happens when you get to the school, who will help you, and then some FAQs for different types of things. That was very useful in the beginning of this situation we have found ourselves in. We have a whole section of our website, as you know, we've talked about that a lot, about everything that's happening with COVID and every announcement, every press release, everything we've ever done. We have renamed it 2021 Updates because it really reflects when we change plans, anything that we're doing ongoing. At first, it was very much just a critical place to find anything COVID, but now it's expanded to many, many things we're doing to operate the 2021 school year. And then, obviously, you've heard us do Connect Eds a lot, and our social media messaging, and then the launching and the maintenance of the COVID-19 information dashboard. I give the credit to Nathaniel Shelton. He is brilliant, and he has a fantastic team of supporters. But he, Amanda Allen, David Pierce, these are the people who are staying behind the scenes late on the weekends and at night, creating this and getting it to where it does these live updates. So I give all the credit to some fantastic people, many, many people who make that happen. And then transportation, we have Chad Holloman here because I know that's going to be a lot of some detailed questions you'd like to hear us answer. But some of the successes that we've had is our bus drivers are provided with masks, shields, hand sanitizers, and very, very specific protocols in transporting children based upon the Lighthouse document and based upon what plan we're in, remembering that there's differences in seating numbers according to whether you're in Plan A or whether you're in Plan B. Consistent sanitizing continues. The one thing that has helped us tremendously, our drivers are doing a lot of driving, covering a lot of miles. We typically like our buses to be running efficiently. We do not have to have that efficiency model this year. We've given some grace with that from DPI, which means that if a bus is not fully loaded, and that's been some of the things we've been trying to do, is even in Plan B, we would still not have as many kids on there as we would like. And so we can try to decrease the number of buses that are running, decrease the number of drivers that are having to be pulled if there's only 4 or 5 kids on there. So that is an ever-changing thing that's happening every week when we're running, trying to maximize the efficiency of how many kids are on it. But from a DPI model, they want to make sure that it really doesn't follow the DPI model right now. Sure.
Are we being held to the efficiency?
Not this year. Not this year.
So,
normally, we would lose money if we were not.
that's what our funds are based on.
Yeah.
So why would we decrease the buses?
We would, for staffing, it's really coming down to being able not to have to pull people out of the school. So if you have a lesser number of people driving, and then just the maintenance of the gassing up of a bus for 3 or 4 kids. So that's a constantly evolving things with those coordinators out in the field, seeing actually how much ridership we actually end up having, because people sign up and then they change. One of the things that I'll tell in the next slide you'll see is we have 4 people who are processing 150 changes a day. That doesn't include any normal routing. So they are very thankful for these remote learning weeks that we have had to assist us. And then you'll see that some of our successes is Danny Williams and the team of coordinators. There are calls that we get until Sunday night of him continuing to call all night long to make sure the buses roll. We've had some situations where buses have had to sit until the whole route has run and then go back and hop on that bus again and get a person to get on it, just simply because we didn't have enough of staff quarantines. However, we have ran school every single day doing that. So I give them the credit. Here's our challenges, and again, very specific questions. Chad, somewhere outside there. And the routing, 150 changes a day. What happens is, whenever your parents have lots of choice, whether they want to go virtual, whether they want to change their driving, back and forth to school, and then every time we do a plan change, obviously you have some changes with that. Bus driver shortages, tracking the student quarantines, who's actually should be on that bus, not be on that bus, and they take a great deal of responsibility to ensure that. And the payroll tracking, believe it or not, we have to figure out who is actually doing an alternate assignment, who's actually driving, who's on quarantine. Those are just some things that are challenging. If you were to move elementary, for example, from Plan A to Plan B, I need to let you know it would take us this next 3 weeks to be able to accomplish. There he is. To be able to accomplish that, just logistically. So that is something you would need to know. And then I think that's the last of my slides, I think. Yeah, it is.
You're talking about take 3 weeks if we make a decision to do that.
Uh-huh.
What logistically you gotta do?
Well,
Take 3 weeks.
right, Chad, I want you to talk about what the ladies and gentlemen over there have to do.
Good evening. So if we would take elementary to a Plan B, currently we are in Plan A, which means that we can max those buses out to the capacity, whether it's 72, 55, whatever it is. So currently, those buses are full. We have quite a few in the district in each area that are at capacity, 65 to 72 kids assigned. So if we would go to a Plan B, we would basically take the cohort data that we have, so we are ahead in that respect. We do have cohort data from our elementary schools. Our elementary schools have continued to update that data so we wouldn't have to backtrack if a plan change was needed. So we would take that data and see how it falls on the individual buses. So currently our buses are routed as we normally would in general areas. So we send a bus to do a route and they come back in. However, the schools have not cohorted kids based on the number on that bus. So when we look at the cohort, one bus may have cohort A if we choose to do A and B like we've done with our middle and high schools. So that whole bus may be A, which would mean we would have to put another bus in service because under Plan B, we can only put one student per seat, even in elementary school. So our routing staff would have to break that data down, see what it looks like, and then ensure that we have enough buses to make that work. If we do not have enough buses to make that work with what we have in the fleet, then we would have to do double runs, which means we would go out and pick out the furthest students and then drop them off and then go back to the next nearest to the school and bring them in. So that would be what we would take. Our 4 routers would need time to break those routes down, see what the cohort data looks like, and how we can use the fleet to meet the needs.
So in Plan A, you can put you can fill the seats up,
Yes, ma'am.
but in Plan B, you cannot?
Correct. Under Plan B, it's only 1 per seat. Yes, ma'am.
So you're
Well, why-
saying, I'm sorry, so you're saying that in Plan A, there's been no social distancing on buses?
No, they had,
The only social distance that I have encouraged to the drivers is that we fill the buses from the back to the front. So the last student that gets on is at the closest to the driver. And that's a recommendation from Kevin Harrison, our state director, to limit the driver's exposure to that student that gets on last. And then the afternoons are built the opposite. So the first student off sits at the front, so they get off.
so the regulations for Plan B, that you're speaking of, I should know this maybe, but where does that come from?
Department of Health and Human Services and
Okay,
DPI.
so that's set aside, we have to do that, okay.
Yes, ma'am.
I was not familiar, I knew that in Plan A that you were loading those buses up,
And-
but
I'm
yeah,
sorry.
okay.
And I will say, Ms. Sessoms, the social distancing, our routers work extremely hard, whether it's this year or any other year. If we see that we have a bus that has 72 on it, but a bus that can serve another 15 students or so close by, then our routers automatically move that as they route the changes. So if a bus has 72 on it, that means that the areas around that cannot be served by another bus. Basically, it increases student time on the bus, which we have a limit for, or that fleet, we just don't have the buses to do it.
I guess my question is, and I just asked that question, taking extra time if we decide to send students back, which is where they need to be. Knowing that we will probably go back in an abbreviated format. Why have we not been working on a Plan B scenario, knowing that it's probably going to come back at Plan B?
Without saying a whole lot, transportation has not been, COVID has hit transportation. Without saying that, we're not fully staffed. Thank you. The other issue with that, Mr. Wooten, is that we sent out a survey for parent choice for second semester. In addition to a normal school year where we see a lot of influx of movements, whether we lose students or whether students come in to our district, that typically has waves. Labor Day is a wave, Martin Luther King Jr. holiday is a wave, and January 1st is a wave, depending on where they're coming and what their semester looks like where they're coming from. Based on the data that we got in December on the choice form that was sent out, I believe we had over 16,000 changes that Tim's had to do. And to say that is 16,000, you have 4 people, you've had a month and a half, great, why isn't it done? The issue is when we are in cohorts, my TIM supervisor and the TIM staff, for every change, we have to change that in 3 databases. A live database, so if the governor would say everybody can go back Plan A, you guys say everybody goes back Plan A, we have that ready. And that's what a normal school year looks like. And I think when we started, we thought maybe we would be there at some point, so we've maintained that data. We also have a Cohort 1 database and a Cohort 2 database. So we have to delete the Cohort 1 students from the 2, and we have to delete the 2s from the 1s. So our TIM staff, and that's hand motion. Every student is touched at least 3 times. So that's why we haven't done it. We just haven't had time and staff.
And I don't ask that to get on you.
Absolutely.
Well,
Parents need to know, so if we went Plan A, for instance, you wouldn't have enough drivers to do Plan A. Is that correct?
Under Plan A, we would, because the buses can be maxed at capacity. Yeah, less routes, so we would. Yes, sir.
And remember, we're running Plan B in 6 through 12. So, essentially, everything impacts, they're all the buses run together, remember? So anytime you make a change on one driver and one bus, even though we've got 612 on Plan B, everything affects, it's all a domino. So when we go changing back from A to B with elementary, remember, we planned for Plan B with elementary, but then when the governor said we could choose A, we chose it rather quickly, we went back rather quickly in a progressive manner, that's great, but then you're going back to what the elementary schools have essentially they planned for Plan B, but never actually ran it. So 612 they haven't. So all those are factors as to why we arrive at February 1.
And that's why I made the point. We do have the data from the schools for cohorts. So elementary staff, kudos to those principals because they have still continued to give us cohort data. So that's why, honestly, it's a little shorter than it would have been coming to you tonight. Had the elementary schools, or had we not proactively thought at some point we may be required to go back into B, then we would have to take possibly another week for the schools and the parents to give us that data and the schools to input it. So the schools have been very proactive. That's why it's 3 weeks and not 4 or 5. Because we have the data we need, we just need time to process it.
You know what students want to come back.
Yes,
you know whether or not they're riding the bus.
Yes, ma'am. Yes, ma'am.
Well, and on top of that, just to remind our public that we run a multi-route system. We stagger our buses. We do not have buses just for the high schools or just for the middle schools. We share those buses among all those grade levels.
So I had an idea several months back, and I know Dr. Bracy might kill me for mentioning it now, but I want to run it by you just to see what impact it would have on transportation. I came up with the idea of the ability for a student to attend school would be based on the number of staff willing to come in who felt safe to come in. So for example, without using a specific school, an elementary school in the community has 80% of their staff that are willing and wanting to come in to work, that 80% should translate to a number that would reflect the amount of students that could accommodate. So we have 80% of the staff could teach 600 or 700 kids, and I'm just throwing numbers out there. If we did that on a site-by-site basis, I know you're probably going to say, oh, that would be a nightmare transportation, but we're going on, what, 10, 11 months now? Somebody's got to come up with something. So if we did do something like that, where you have a high school that says, okay, we've got 40% of our staff that want to come back, they want to be face-to-face with kids, we can accommodate X number of students based on that. Now, I get it, curriculum would be limited and you would have course specialties and all that, but there is a way to work it with a number. How would that impact the transportation by having a variance in the attendance based on a site-by-site ratio?
Basically, if whatever model that we're given, we improved our system. Donna Knipe, our TIM supervisor, who I've mentioned, and I think you guys met a couple months ago as a special recognition, she has streamlined our procedure where the schools input their data into PowerSchool, and then we get the data from them, who's coming and who's not. And then we use that data to assign them to a bus or take them off a bus, whether their need is. Same thing for virtual cohort 1, cohort 2. The school gives us that data, tells us who to route, and we route it based on our buses and numbers. So if the school gave us that data, we can route it. It may take some time, but we could route it.
Well, time is something that we have utilized a great deal of in the last 8 or 9 months. So, I mean, in the foreseeable future, hopefully that's not an issue, but it very well could be. With that being said, if you have that type of system, it would be easy to revert back if you've already planned for it. Is that correct? Or would you have to go back and manual and it'd be another 2 weeks?
If you're saying if it didn't work and we had to back up, we always archive our data. So the routes from last year, I can pull up this year and show you. So, speaking tonight, currently elementary school is on plan A. We have those routes created. We were running them anyway. We will never dissolve those routes. We will archive those routes so we could go back to them next year at this time if we needed to study trends or anything like that.
Thanks, Jeff.
Yes, sir.
So I have just an overall general question, and I think I knew the answer to this question. If K-12 went back B, then those bus routes would be a lot easier to manage, right? Versus having one group at A and one group at B. And if they all went back to A, obviously everything would go back to normal. But just looking at having everybody on the same plan would be a huge saving in time for you and your staff, correct?
Yes, ma'am. I have to sing Donna's praises again. Donna has figured it out. She has, worked some weeks 80 to 90 hours a week at home. She manipulates that data. I'm not going to sit here, I'll be honest with you, and pretend to explain it to you. She has figured out a way where she can combine the cohort B, like a high school cohort under Plan B with the elementary, and that driver only gets 2 routes instead of like 4 routes. When they get their cohort route for high school and middle school, the elementary kids are attached to it. And then for the cohort 2, she prints them a route with that new cohort, but the same elementary student. So she has figured out a way to do it. However, if everybody went back the same, we would route it that way. So she wouldn't have to piece it together. Currently, she's having to piece together Plan A routes with Plan B. And like I said, I don't know how she's doing it, but she's doing it.
That's what we have from our department. We'll take any other questions from any of my other areas, or I'll turn it over to our next group.
And I want to do this in brevity, extreme brevity. I know on December 8th, we were discussing Chromebooks at length, and I'm aware that we had our meeting Tuesday and we had some additional Chromebooks go out that week to various schools.
Yeah.
Is that a concern anymore? I realize that it may not have found its way up to the technology department, but is that of any concern anymore?
No, every one of the, if anybody had any request at all, we get that information to us. So even if a school said they were short and they needed something, we were there at that point to know what was happening. A lot of what we ended up having to do in that short amount of time was hotspots, a lot more hotspots. And then the charging cords, you saw that large number of charging cords. The kids had lost them, people had lost them. And then fixing the situations where there may have been some concern about whether the whole family got them or not. So those resolutions were made. And in one situation, I know we actually had to physically move some and get those there. And we still await our shipment. We're still awaiting our shipment of almost 6,000 that would help us. But again, what you saw was we had 26-some thousand, but we have 40,000. Do we want to get those other ones in? Yes, because they're healthier. They're better devices, and we want to do some switching out.
Sure, and the teachers I'm in contact with were very appreciative that they said the Chromebooks were brand new, had a great logo on them, so they were excited to get them a couple days later. So I do want to say thank you for that. And it does, I mean, we could see the challenges it would create for siblings to share Chromebooks and, you know, yeah, exactly. Yeah, I remember me and my brother. But yeah, no, I want to say thanks. And unfortunately, that was the case. But fortunately, it's not anymore, right? We're good there.
But we are in very good shape. Anybody who is, anything on that form is everything that anyone has requested from us. If there are other requests that's happening now that we're back in, again, I haven't seen it. It might be a straggler here and there, but we have pulled all the stops out to get anything out to anybody. We literally had, with the help of Mr. Britt's department, we were buying charging cords and stuff and getting them here overnight. It's literally like a drone, felt like it came and just dropped them at facilities. So we've been really ramping it up. Now, you know, some of our teachers had to go from having a beautiful remote setup in their classroom where the kids were home and they were in to we needed them to be at home. So we've had to help work through, you know, getting their webcam and their setup back at their house again. So there's just a lot. And then the digital support that Dr. Lanier's team provides, because, you know, the longer you stay in remote, the more you have to adjust your instructional strategies and how you work with these software resources. And that's why some of these things that you see up here are repeats, because we want as many teachers as possible to sign up for these classes, and some of them have to take it more than one time, like me, to figure out how does that work in what I'm doing. The kids are absolutely amazing in what they're able to do at the house. I will say, though, that it is always a challenge when you have kids at home. You know, I caught my own kid up putting golf clubs this week in the bonus room, so he'll kill me for that. But those are the kinds of things that kids are going to do, and we just have to work with them on that. So we appreciate a great number of team players who really made that short window happen in December and got these kids where they needed to be.
And, you know, Dr. Bracy, Ms. Gill, and Dr. Coates, I would just humbly request that entertain doing a draft or some type of mock-up of how that site-based would work or could work. Because if we're in this for the long haul, I mean, you know, we could decide to go back today, but if something manifests and we're unable to go back, I would like to have a plan D as opposed to what are we going to do. So if that's something that we can do and start looking into, making it site-based, and, you know, there's probably 1,000 problems I haven't thought of, but, I mean, given the time we've already undergone this, we may have more time, so.
I'd love to sit with you.
Absolutely.
And hear greater detail about it.
Well,
May I ask, you know, have we run the program I asked about last time? Do we know how many students maybe we're missing out there?
Right. During the course of the presentation tonight, you're going to start hearing bits and pieces of that. We did provide for you all, that was actually in the CIA department, some initial ClassLink analytics. And then with Ms. Roberts' department, that wraparound service of who do we know is logged in with ClassLink, who is logging in directly through Google Classroom, and some of them do that, so that's hard to capture. the teacher being able to monitor what kids are doing, the attendance they're taking, and then at the end of the day, what Ms. Roberts is really punctuating is the social workers getting in touch with these families. So with all of those pieces, you are able to get a good sense. Can I give you today that there is 20, the principal probably can tell you. I can't tell you that there's 20 at Polenta and that there's 40 there. I can tell you we have the provisions in place to help support the schools and making sure that the students are accounted for and are working and engaged. And engagement is a big question, but part of that means I'm logged on. So it's a very complicated and complex question with many layers to it, but are all the pieces in place that help us to make sure that children are not lost? In my opinion, at this stage and what we have had to learn to do since March, yes, we have come a very long way.
Ms. Gill, I know you're about to walk off, and as we close the facilities, technology, transportation part of the presentation, what I clearly hear from your presentation and from my conversations with Steve and Britt, not only is PPE stacked and in reserve, but Steve and Britt has told me what is needed, he has the funds to purchase whenever we need it. So we can eliminate the PPE concerns because of that.
And we're having lots of great suppliers who get us things much quicker than we were in the past, yes.
Certainly. And the technology piece, I echo Mr. Johnston's comments by thanking you for taking care of that. And I just want to say, for anybody that's listening, if you need a device, let your principal know.
Correct.
Because not only do we have technology ready to go, but Stephen Britt says we have money sitting there to purchase technology as needed, as he's done with us the entire year. So certainly I'm thankful for that.
Thank you, Ms. Gill, for the updates.
I got one question, Mr. Sutton,
departments.
just real quick. You said 3 weeks. If we were to make this decision tonight, 3 weeks is February 2nd. February 1st? All right.
Which would put you 30 days from New Year's Day, as Dr. Pearson talked about the spike that's yet to come. Thank you.
Thank you,
Thank you, Mr. Holloman.
Gill. At this time, we will take a 5-minute break before we go any further in our discussions. that's Dr. Coates. I can't tell, but
It is.
well,
That is her.
that is you.
It's me. The mask threw you off because it's a store-bought one, so. I'm glad to be here, and I want to just say I've appreciated everything everyone has said. But in our department, unless it's the child of an employee, the student rate has not impacted us, but the adult rate has. And I will tell you, we are in triage mode, as I put on this PowerPoint. We have 84 people, or had 84 when I calculated this on the central sub list. 77% of them come from our department, and they're out all the time. So because of that, and we're glad to serve the schools that way, but when we serve the schools that way, we sacrifice serving the schools for the reason we're over there, and that is to provide curriculum, instruction, accountability, support to them. So you can read those little points I've talked about. In addition, we've had 5 certified resignations or transfers, people who've either retired, left, moved to a different job internally, and those responsibilities have been picked up by other members, and that also includes some folks that did those decisions last year. So our folks are juggling about everything they can juggle. And you know how it goes when you have too many things on your plate, you don't do all of them as well as you would like to. And so when you combine that with being in the school sub, and it has really had a hard impact on our department. It has really hindered the implementation of our district strategic plan, and as I've already stated, this instructional supports to our schools. So our folks are working hard, and they're working long hours, and they're doing a lot of great things, but the bottom line is they're just kind of at a tipping point. We're kind of there. The other impact, and I try to just put things in here that impacted significantly by COVID itself. The other impact is our remote, virtual, and face-to-face settings. And that is because, we've separated teachers in K-5. Well, that makes the teacher preparation a little bit more simple or easier. But there's disadvantages to that because of the class size limitations that are placed upon us. We've had to assign some students who are in virtual environments to schools that are not their home school. And that's just not always a good thing, especially in younger grades. That's a K-3 requirement. So in K-3, we've had to assign students. It's difficult for us to provide support services when we've got students assigned to caseloads and things like that, and people centrally who are assigned to serve schools, but the kids at those schools might be at a different school. So they're all over the place, and that's made it difficult. In middle school and high school, our teachers have to teach both ways. There's no way around it. They have to. We just don't have enough teachers to separate, which that makes that harder. So that makes strategic scheduling harder, and it makes PLC planning and sharing harder, which is how we get better by looking at data. So since I've said the word data, I've brought Ms. Stevenson, our data expert, to talk with you a little bit about some COVID impact trends and how it may or may not have impacted our assessments. Ms. Stevenson.
Good afternoon, or good evening, I guess. I'd like to start off by commending our high school test coordinators and testing teams. They've been hard at work since well before the holiday break, developing test plans that would allow us to bring our students in safely as our state EOC assessments are required to be given on site. Currently, we are at a 92.5% test completion rate, which is wonderful. Our goal was to get or surpass 95%, and the fall window for testing has been extended through February 12th. The state has also allowed some additional flexibility beyond that, so we will be able to test students who don't test this fall when the spring window opens at the end of the year. So, looking good towards hitting that 95% test completion rate. Here, we've presented what our changes in proficiency have been. It's really hard to do comparisons fall to fall simply because a lot of our high schools, strategically plan. For example, our math. Last fall, we had like 703 students enrolled in Math 1 first semester. This fall, we only had 301. So it's really hard to do comparisons when your membership varies so much from fall to fall. So really, it's best to do comparisons looking at full academic years once testing is done, both fall and spring semesters. But just to give you some perspective of where we are, in Math 1 and Math 3, when you do compare our fall this year to fall of last year, we are down in proficiency in both of those subjects, whereas when you look at the full academic year from 2019, which was the last time we had both fall and spring data, we're actually up in proficiency. Biology, fall to full year comparisons, we are showing a negative trend there. And in English 2, we are up in proficiency compared to the fall and down slightly when compared to full academic year. Our composite, meaning combining all of those EOCs together, our overall proficiency is down by about 2.5% when you do a fall-to-fall comparison, and up just slightly when you look at that full academic year. The schools really utilize their fall data to help with instructional planning for the spring semester, and we have provided schools their goal summary data as well as growth estimates for students to help PLCs in their decision-making process. When we start thinking about the achievement of our students in grades 3 through 8, we have our MAP data, which is our benchmark assessment data that we use. At the beginning of the year, we looked at learning loss. And in order to look at our learning loss, we said, okay, the last time we had our MAP data was last winter, so last January, compared to how did they start the year. And when we compared student percentiles, we saw more of a decrease in math than reading. So the school closure last year had more of a negative impact on our math achievement than our reading achievement. And also keep in mind, we did implement a reading curriculum last year, so that could have contributed to some of that, why we didn't see as much as a loss in math. But also compared other groups and that have studied learning loss, the math has shown up in those studies as being a greater loss than in reading. But if we look at where we are right now, this is looking at projected grade level proficiency. So MAP gives us a projection as to by the end of the year, what percentage of students do we expect to be on grade level. And just to review kind of how to read this chart, if you look where it says 6th grade cohort, that blue bar represents our fall 19 data. So that would have been when our current 6th graders were in 5th grade, at the start of 5th grade. The orange bar is our winter of 20 data. So that would have been with that 6th grade cohort when they were in 5th grade, winter, January, before school closure. The gray bar up there represents the start of the 6th grade year. Now, one thing I would note there, you'll notice for our 6th graders, we had more students projected to be proficient than we did before school closed. One thing we should consider when we look at this data is that the beginning of year assessment was given remotely. So, there could have been some extra help given there. And then that yellow bar, gold bar is representative of our current data, where we are right now. And if you look...
And that's given remotely as well?
No. That was given, the majority of that was given before we went back to...
Okay.
Because we only had one more week of the window before we went back home. Now, a few kids may have taken it remotely because we did extend the window an extra week. So when you look at where we are projecting, Our 6th and 7th grade are in about the same place, or actually doing a little bit better than where we were projecting last year at the winter administration of the test, and the other grade levels are below. However, one point I want to make is when you go back and you look at our EOG from 2019, our composite there was right at 51%. And if you look across that bottom there, you'll see all grade levels are projected at or above that percentage. So our reading projection is at or above where we were at the close of 2019. The next slide looks at reading from a growth perspective. And when we talk about growth, we're talking about where is the student at, meeting the kid where they are, and are they growing, whether they're below grade level, above grade level, or right at grade level. So again, going back to my 6th grade cohort example, that blue bar is representative of a year's worth of instruction, what percent of students made growth. So that would be the transition, if I'm looking at that 6th grade cohort, from 4th to 5th grade. Okay, when we look at the orange bar, we're talking those kids in 5th grade from fall to winter, what percent showed growth. So due to a half of year's worth of instruction. The gray bar would be our 5th to 6th grade transition. Now, notice the gray bars are lower than our blue bars, which typically would be a year's worth of instruction, but we really only had 3/4 of a year's worth. Okay, the last quarter was remote learning. And then our gold bars is growth this first half of the year, so where we are. So when you compare our gold and orange bars to each other, our growth is lower than what we saw from fall to winter, except again in our middle school, 7th and 8th grade. We actually are seeing more growth, or more students making growth, than we did in winter to fall. So while our projection for on-grade level proficiency is at or above where we were summatively 2 years ago, our largest gains in terms of growth is being seen at our middle school level. When we talk about math, our math, when we look at grade level proficiency in math, you'll notice that, that comparatively we are lower than we were in reading. Again, I would highlight that we saw more learning loss in math when we looked at it from the beginning of the year. And one thing I would say about math is we are lower, if we go back to the end of 2019, our summative data, that composite for math, had us at 58.6%. There, if you look at that last line, you'll see we're projecting between like 45 and 50%. So our math proficiency is projecting lower than where we were 2 years ago. But when we turn and look at the growth piece, though, which is on the next slide, our fall to winter there, so looking orange to gold comparisons, you see that we're seeing about the same amount of growth that we saw last fall to winter. And when you compare that gray bar to your gold bar, you'll see our growth has really kicked in for math. Those gray bars are low, which is that indication of that learning loss, but we see that kids are making good gains in math. So while our projection is lower for grade level proficiency in math, the growth is there, which is what we need to see because of all the learning loss that occurred. There any questions?
Christy.
Have there been any type of, I don't want to say studies, comparisons done for students who are meeting or not meeting growth, who are attending face-to-face or who have attended what we have offered face-to-face, as opposed to students who have or have not met growth who are strictly virtual? Has there been, I've sat down with several teachers this weekend, and they kind of showed me their very localized classroom results, and it appears that if you're face-to-face in their specific instances, they're exceeding growth or meeting growth. If they're not face-to-face, they are not meeting growth. They're actually regressing. Have you guys looked into anything?
We have not from a
Okay.
district perspective, but that, we are providing schools, and our goal is to get it out this week because the window just closed Friday. But we are providing schools with resources on how to look at your growth data, and I think that is an excellent piece to bring, not only just look at growth as a whole classroom, but the face-to-face versus virtual as well.
And you said we could expect those. I'm sorry. Did you say you put it out there for them to respond, or do you think they'll have like a formalized presentation for that for us at some point?
So we would have to work with the schools on knowing which students are, for us to do the analysis, we would have to know which schools, which students are actual virtual compared to face-to-face to flag that, to do that analysis.
So in essence, it would be the teachers turn it in to you guys, and you guys compile and present the data.
Or is there a way?
We can probably get it centrally.
Yeah, if there's a way we can get a list of kids who are virtual versus face-to-face, we can do that centrally.
Thank you.
Yep.
Christy, I know that the new State Board of Education has taken over, and our new state board superintendent has submitted to the U.S. Department of Education some waivers. So can you just let us know, what is our district doing to assist those kids that may be negatively impacted due to the remote and so forth of the circumstances that we're under? Are we asking for this type of waiver as well from the state, which has, they haven't heard back from the federal government, obviously, but what processes are we putting in play to maybe assist those students?
So the state requests the waiver, and if the waiver is granted by the federal government, it would apply to all LEAs. So for example, the state has requested a waiver from the 95% participation consequences. So if that is granted, because consequences right now are for schools that in math and reading, if they don't meet their 95%, then by whatever percent they miss it by, those scores are counted as not proficient. So if the waiver is approved, then we would be held harmless there. Other things that we are doing centrally or as a LEA to help students is some flexibility that districts had in terms of EOC exam grades, because the exam grade must count as 20% of the final. We set a floor of 50 to be the minimum grade a student could get or would get on their exam as long as they took the assessment.
What is the school? I know we have I saw the chart of how many were absent from certain schools, and I know we had 2 that had some pretty high numbers. Are we out there trying to get those kids in and try to get them tested?
So each school has their own makeup plan. Schools are reaching out, contacting families to schedule, the time for their student to come in. And as I mentioned earlier, we have flexibility to give because typically your assessment window is that last 5 days of the semester, and then you have 10 makeup days. Well, they have allowed us to test what's called test outside the window, and and that is stretched through February 12th, and then we'll open it back up in the spring. So yes, schools are working to reach out. They know who's not tested, and they're reaching out to the families to schedule that.
Christy, thank you for all of this data. This is just very compelling. I find it very interesting that our middle schools are, and not because I'm surprised that our teachers aren't working as hard as they know how. I know they are. But that our middle schools are doing this well in terms of the fact that they were virtual for part of all virtual for part of the semester, and then at least 3 days a week virtual on the hybrid, the Plan B. So, that's a shout out to our teachers who have worked so hard with the virtual instruction.
And before we go any further, we have to give a shout out to our data managers and the people. I know you spoke, Dr. Coates spoke, and all the people. I congratulate everyone on the hard work. But as we talked about moving kids to other schools virtually and stuff like that, our data managers are all over it. And if anybody's listening, we appreciate you.
And I have to give kudos to Jennifer Jacobson in our department as well, because our map window just closed on Friday, so she has worked feverishly so we could present this to you tonight. Thank you.
Thank you, Dr. Coates and Christy.
Ms. Roberts, can you come on in? I'm sorry. I know I forgot you were virtual.
That's okay. Good evening, Mr. Sutton, Chairman Sutton, Lady Vice Chair Sessoms, members of the board, Dr. Bracy. It's great to be with you virtually this evening. Before I give you my very, very brief report, I do want to take this moment to thank every member of the Equity, Information, and Student Services Department because their heroic spirits have not only served us well, but it also serves to inspire us, serves as inspiration. So you're champions, you are valued, and you are appreciated. And I just wanted to take that time to let them know how very, very important you are to Johnston County Public Schools. Ms. Gill hinted toward this report's focus, and it's going to be short and sweet, as I said, because I want to laser focus on the Herculean work being done by our school social workers to ensure that students are engaged. CIA and EIS work interdependently to perform the due diligence that must be done in order for students to achieve in school. So with that being said, student engagement cannot happen without students in attendance, which is two different definitions. And that student attendance is tracked by our Stellar Information Services Unit. So when a student is reported as not engaged or a no-show, our school social workers literally conduct a search and find investigation. This is no different than what we're doing this during the pandemic, but we've been doing this, before the pandemic. So this is what we do. So if you look at the slide that we've provided for tonight's presentation, again, with a laser focus on student engagement, a considerable part of our school social workers' role is and continues to be to assist our district with retaining students. Because if they are not retained and they are not present, then they cannot be engaged. We're responsible for showing that work by submitting data to the State Department in the fall of every year. So this report contains the number of no-shows and dropouts for our district, and you heard that report from Dr. Allen last month. What we want you to know is that of the number that we cannot reach, we do notify local authorities to assist with finding and helping those families. So as far as we're concerned, They're not unaccounted for on our end. We know that these students may be missing, but we engage our local authorities and state sometimes to assist with finding and helping the families. So this service is our standard. It will continue to be our standard. And just so that you have a really great idea of that search and find mission, we've notified authorities for assistance with 27 students, not thousands, just 27. And we know that 27 is too much. But we want you to know how very, very hard the wraparound services works, the professionals in wraparound services work to ensure that our students are present and engaged. And that's my report. If you have any questions, I'm happy to entertain.
Ms. Roberts, please pass along our heartfelt thanks to all these folks who are working so hard to not only keep up with our students, but care for them.
Yes, ma'am. Thank you so much, Ms. Sessoms.
Do you have any idea, Ms. Roberts, of, and I probably might be asking the wrong person, of our attendance?
Our
While
participation,
virtual, do we have any record of attendance as they are keeping it for virtual instruction?
oh, absolutely. We track attendance. The
How has
teachers
that
take
been?
attendance and we track it. So our participation rate was about 90% back in November, but because of the fact, Ms. Andrews, that we have gone from remote back to face-to-face and remote back to face-to-face, it has been a bit challenging to keep those records, although we do it. We want you to know that we are tracking attendance. Absolutely. We take attendance every single day.
But that attendance number can change because isn't it if a student is not online, but they turn in their work, you come back and count them present? Is that true?
That's exactly right. The students, the teachers can give our students time to turn their work in, but they are expected to participate and show up.
Okay, thank you.
You're welcome. Thank you.
Ms. Roberts, I just echo what Ms. Sessom said about the hard work that's being put in from the social worker side. That everybody that's involved in this capacity, you know, I've had the opportunity to hear it firsthand the past couple of days that I've been at home, just how the middle school is working to make sure that these kids are online and they're actually doing their work. And even to the point where, you know, the teachers have the cell numbers for the parents and they get them on the phone to let them know that their kid may be logged on, but not necessarily participating. And if they're at home to assist. And it's just been good to see that communication level be that high, but I know that there's a lot of kids that were missing in that capacity too, due to the structure and things that they may not have the opportunity to have a parent or guardian at home. But we do appreciate everything that your department is doing to assist our students. And like you said, there's 47 that, 27 that we haven't found, and that's 27 too many. And I appreciate everything y'all are doing to try to locate these students.
Thank you so much, Mr. Sutton. We appreciate that. We appreciate the acknowledgement.
As part of our COVID update, we wanted to give you a sense of where we stand with our personnel. So I have two slides to share with you. The first one is where we stand as far as vacancies. And you can see for classified personnel, we're at 131. That may not mean much, so to give you some comparison, last year about this time we were sitting at around 80, so we're 50 more as far as vacancies are concerned from last year at this time, and you can see the categories below that to give you an idea of where those vacancies fall. And then as far as certified, we are at 66, and last year we remain between 30 and 40. So we have seen an increase this year for certified vacancies as well. And again, you can see the categories below there. As far as teleworking, I know that you've asked a few times, so just wanted to give you the most up-to-date numbers. We have about 250 staff members who have been approved to telework. And I say approved, we've had many requests, but as we've talked about in here several times, there are fortunately some positions that we have in our school systems that allow individuals to work remotely when there is a need. But unfortunately, there are some positions in our school system because of the types of tasks that are involved with those jobs that they cannot work remotely. But about 250 of them are working remotely at this time. As far as sub-data, we've talked about this in here before, but I wanted to make sure you had it in print. We have about 855 subs in our books on record, but only 250 of them are actively working. That's not 30%, it's about 29 point something percent. And another thing to consider is out of that 250, some of them prefer levels. So some of them only want to work in elementary schools because maybe they're a retired elementary teacher, that's where their passion is. Some of them may only want to work in middle and high school. So if I'm a high school principal and out of the 250, there's one who prefers elementary, well, that sub isn't necessarily helping me. They're helping the system, which is great, but as a high school principal, that person's really not helping me when I have those absences that occur. And then you have some that prefer regions. So if you have a sub who resides in the Corinth area, they're not likely to accept positions maybe in the Four Oaks area just because of the fact that the commute is going to be so long for them to drive. Now, some do, and we appreciate that. But just to give you an idea of what those numbers really mean when you try to break them apart and look at it. The other thing I wanted to share with you is that our fill rate, something that we look at, and that is out of the number of positions that someone is absent in on a day-to-day basis, how many of those require a sub? And then what's the percentage rate of subs actually securing those spots? In September, when we were in Plan C, we were about 72%, meaning 72% of the absences needing a sub were filled. That has declined. In October, it was 57, November, 44, and December, 46. Now, December is a little bit tricky because the last week we went back to C, which is remote for all, and so the need wasn't quite as high. Again, it's important to know, well, where were we last year? When you go back and you look at December of 2019, we were 70% plus as far as the fill rate for our subs. So I've said it before, we love and appreciate our subs, but substitutes are not permanent employees. They do not have contracts with the school system. We can't force them to work, and we're at the mercy of them wanting to work. And then we're at the mercy of them wanting to work, whether it's elementary, middle, or high school, or certain portions of the county. So I just wanted to bring those few things to you from a personnel standpoint, and I'll be glad to answer any questions that you may have.
I know this is a tough question for you, and I know just off the top of your head, when we say 94 elementary teachers have asked for accommodations, what percent is that of our elementary teachers?
I would venture to say that we probably have 1,000 plus.
What about middle?
For middle and high school, I would probably put those together as well and say a little over 1,000. I could be wrong,
that's
Ms.
fine.
Andrew. That's a guess on my part.
What, we got 3,000 teachers, right, in Johnston County?
A little more, yes.
Yeah, and I know staff-wise, we got about 5,000.
Correct.
But a little
And
more
that's
than
looking
3,000.
at all staff.
Right.
Part-time, full-time, temporary. Now, again, these are the ones at our office, the HR office, who I cannot thank them enough. I know every person up here has thanked their department, so I'd be remiss if I didn't do that as well. we have a great team who works very hard and looks at each of these requests as they come in, because they're not easy. We have staff members who unfortunately have medical conditions that we've not been able to honor that request, but certainly we've looked at them, we've worked with them to maybe get some specialized PPE, to look at maybe modifications that can be made in the workplace, to look at options such as leave, any benefits that they may qualify for. So the team has really worked hard in trying to do our best and working with the many requests that we've had from our staff to make
Now,
them
are
feel
these
safe.
individuals, elementary, middle, and high, are they teaching virtually?
Yes, some of them are at home. Some of them are teaching virtually, but the principal has worked with them to isolate them in an area of the school so they're not exposed to others.
Right, but we're still utilizing their skills and instruction.
That is
obviously,
correct.
just even though they have accommodations yet.
So these 250 who are out on medical accommodations, you add to that the 66 certified vacancies that we have right now. And then on top of that would be the numbers who would be in quarantine, correct?
Correct.
And what are principals, I mean, what I've heard from principals has been that staffing in November was a huge problem.
Right. So staffing has been a challenge throughout this year, but it has become increasingly more challenging as we entered into November and then December as well. It's not on the document before you, but we also have the central coverage list that we've talked about in here. We have about 84 members who are on that team. These are central office administrators, central office employees who have the skill set to be able to go out into schools and serve as subs, to serve in a principal's absence or an assistant principal's absence when they're out sick or being quarantined. And we've utilized that daily. Dr. Coates will share with you, or if she was back up here, she'd probably share with you that there are some from her team who have been out of the school every single day, away from their normal responsibilities. And it's not just her team as well, there's others, but the majority of those 84 do come from CIA.
So these 131 classified, and I appreciate the way you broke that down. What kind of burden does that put on our system?
So, as far as school nutrition is concerned, I'll start there. I think that that may not have been as much of a burden on school nutrition because of the fact that we have a blended approach. Now, Dana might say some things differently to that I'm just not aware of. But you know, certainly we'd love to have 0 vacancies there as well. But I do know that it takes a team even to prepare those meals to have it curbside. So I certainly don't want to take away from what they're doing and say that having 45 school nutrition vacancies hasn't had an impact. I think it certainly has, but taking into account the blended approach that we've taken, it maybe hasn't been as much of an impact as it would be if we were all in school. Now, one thing I will say about school nutrition is that when we hire school nutrition employees, as well as teacher assistants and custodial staff, we hire them to drive our buses as well. So there's 45 people that are not in the schools to be able to help with transportation from a school nutrition standpoint. And then from a TA standpoint, you have 56 people who are not there to support their teachers, but they're also not there and available to transport students to and from school each day. And then you can see the custodial numbers, and of course, we've been utilizing temp services to help with those vacancies because we want to keep our schools as sanitized as possible so that our staff and our students can remain healthy during this pandemic. But there certainly has been an impact. And again, I don't want to take anything away from school nutrition, but I wanted to give you, I guess, my assessment on that. But they certainly have been working hard, just like every other staff member has been during this time. All right, well, thank you for your time.
Thank you, Ms. Vetrano. I'm going to ask Ms. Whittington, as she walks in now, some of the questions that we've received from board members have been feedback from schools, sustainability. Ms. Sessoms just mentioned the staffing and the impact on the schools. I'm going to ask Ms. Whittington to share some of that information at this time.
Absolutely, thank you. Good evening, Chairman Sutton, Lady Vice Chair, Ms. Sessoms, members of the board, Dr. Bracy, and everyone viewing tonight. I will be sharing school feedback and impacts. It was very important that we obtain the most relevant and precise feedback from our schools on the return to school plan. Our school leaders, our school staff, our students, our families have done an amazing job exhibiting resilience and flowing with the necessary implementations and changes that have occurred since the beginning of the school year during this pandemic. We met with the principal school subcommittee of the Return to School Task Force, which consisted of 2 elementary principals, 2 middle school principals, and 3 high school principals. We discussed what was the best approach for gaining feedback and decided on a school survey. The survey was created and consisted of 6 questions. To gain input on the completion of the survey, principals obtained feedback from their staff through a variety of means: staff meetings, conversations with staff, PLC meetings, surveys to staff, meetings with leadership teams, and school leaders. It was also very important that we received feedback from all 46 schools, as every school has experienced this year's return to school in different ways, and needs can be very different. Dr. Bracy shared with you the complete spreadsheet of the entire raw data representing all schools. We had 100% participation and submission. I would also like to know that we had 2 submissions of the survey. The original survey went out to schools on December the 10th and was due back December 18th prior to Christmas break. Upon returning on January 4th, schools shared that they felt their feedback and data might not be representative to their current thoughts due to the changes in our state and our county based on COVID impact. A new submission was shared with all schools, allowing resubmissions, any edits, any changes, any additions to the original data. So the data that was shared with you was reflective of January 8th. So tonight, I'm going to share with you just a summary of a few of those questions that were shared with you in its entirety. Question 3 asked, what adjustments and or revisions do you recommend to the current plan? Plan A, we know that elementary has been in Plan A, and Plan B for middle and high. For elementary schools, the Plan A adjustments that were shared were smaller cohorts of students on campus, and this would allow for safely socially distancing, allows for dedicated cleaning day when students were not in the building, would maximize the quality of instruction with smaller groups of students, and will allow for a PLC planning day for teachers to focus on continually meeting the needs of our students. 2, pre-K and self-contained exceptional children's programs return sooner than other students. 3, consider a 4-day week to allow for deep cleaning on Wednesdays, additional planning for teachers, dedicated time for MTSS intervention, data analysis, and professional development for teachers. And 4, Plan A, K3, and Plan B, 4-5. K3 has a class size that's mandated by the state at 21 max, but this would also eliminate larger classes in upper grades where there is no cap. For middle school, Plan B adjustments, better process for teleworking expectations and criteria, all grade spans on the same schedule to reduce exposures for families, and look for alternatives for teachers having to teach both face-to-face and virtual. It's very difficult for teachers. For high school, Plan B adjustments and revisions, Bus routes need to be revised to be more efficient, and this would reduce the number of people being pulled from elementary and middle school to drive those routes. B, based on student needs and performance data, allowing cohorts the flexibility with options for students attending more than 2 days a week, possibly on a Wednesday or even other days in the week as deemed necessary by their intervention plan or their current academic performance. Minimizing and simplifying the current attendance codes for a more accurate reflection of student attendance and better record keeping for teachers. Question 4 was, what are the top priorities for need right now in the schools? The number 1 was the overall safety of our staff and students. Among other high ranking was additional coverage. As we have talked about tonight, staffing is a huge issue in our schools. One suggestion that was even mentioned as a possibility to help with this is we have a lot of teachers who are able and willing to teach additional classes that have vacancies in our school, possibly during their planning period or even at an alternate time during the day. So prioritizing funds to compensate certified staff for additional coverage time could possibly be a solution to that potential issue. Consistency of teaching and learning model for the academic success of our students and the planning and delivery of instruction from our teachers. Additional assistance with cleaning and sanitizing. Additional assistance with COVID-19 issues and protocols. Engagement of students and student overall attendance to online and face-to-face class. And additional technology deliveries. This is in relation to technology deliveries that have been ordered but not delivered to the school, and I think this is in reference to outdated machines and new ones replacing the outdated machines. Question 5 was, what has worked well under the current plan? Plan A, elementary, and Plan B, middle and high. Having students back in the building. Obviously, it is wonderful to see our students and engaging with them on a day-to-day basis. Teachers are able to identify social and emotional learning needs with students in the buildings. Remote makes that more difficult. Technology under Plan A has worked well. Students and staff have adapted well to COVID safety protocols. I think they've gotten used to having their temperature taken and things before they get out of the car. Student success has occurred for students K-12, not only academically, but with building relationships, connecting to students, and meeting individual needs. In a Plan A and a Plan B, having a face-to-face opportunity to address student needs and remediate. Parents having a choice of virtual or face-to-face. And intervention strategies are able to be monitored and implemented more effectively if students are able to be seen face-to-face during the week. And question 6 was an open-ended question asking schools to share any suggestions or information that may be impactful to the planning. I categorize these, or we as a task force categorize these into 3 categories: safety and well-being. With the current rise in hospitalizations, positive cases, and the new variant being more transmittable in children prompts concerns for the return to school. Can there be a metric for when the district or a school is no longer safe to maintain Plan A or Plan B model due to the number of staff who are quarantined and the lack of subs available? The district should consider site-based decisions for closing face-to-face instruction. If a school is functioning and thriving, the entire county shouldn't have to transition to remote learning. A full-time nurse or healthcare professional assigned to our school on a daily basis is needed. Staff is fearful of losing additional staff and family to the virus. Elementary class size and upper grades makes it, in some cases, impossible for social distancing under Plan A. Plan C, virtual learning virtual teaching and learning supports the health, safety, and well-being of our students, staff, and their families. Staffing and additional assistance needed. Staffing is an issue with the rise of number of cases with a limited number of substitutes available. Staff is being asked to cover multiple classes that take them away from their normal duties and exposes them to a wider variety of students and staff. More support for engaging families and students in virtual environments. While remaining in Plan C for Q3, it would continue to provide separation from the holiday gatherings and more time for vaccine distribution to staff and families. And as we move forward, it's extremely important that we make transitions or we make changes at times that are natural transitions, such as quarter or semester, to protect the teaching and learning consistency. While we physically can receive students on short notice, teachers need planning for virtual and face-to-face lessons, which are different in many cases. Teachers, students, and families need time to adjust to major shifts in planning. We need flexibility and the ability to allow students who are failing to attend both cohorts and multiple days if on a Plan B. Build routes to maximize the capability of each bus, a better process for transportation changes and routing needs. Many buses have very few students, and those drivers are needed in their primary roles. Implement the 10-day drop rule, and pulling TAs, custodians, office staff, etc., to drive buses with potentially 1 to 5 students is hurting our capacity in the buildings and allowing other critical roles to go unfulfilled. And additional qualified support is needed for the supervision of our safe room. And then finally, teaching and learning. It is difficult for teachers to support student needs by juggling multiple groups of students, both virtually and face-to-face. And with a consistent method of content delivery, it allows for well-prepared lessons and a delivery to students.
Thank you, Ms. Whittington.
Yes.
Any questions for Ms. Whittington?
I was just going to say, this data is a result of a lot of hard work and a collection of feedback being shared by our principals and schools and the analysis of the feedback. As a district, I think we find it very impactful on ways that we can improve our processes and our procedures related to returning to school, but also very impactful for the decisions moving forward.
Thank you, Ms. Whittington.
My apologies, Ms. Whittington, for interrupting your last statement there, but we do appreciate all of your information. Is there any questions from the board to Ms. Whittington? If not, let's take a 5-minute break and then we'll come back and complete this segment of our discussion with our decisions that we need to make going forward.
Thank you.
Thank you, sir. Dr. Bracy, I just want to say that I haven't experienced it in the boardroom, but I do appreciate all the time and effort that you and your leadership team has spent putting this presentation together, as well as providing all the answers to the questions that the board has had over the past couple of weeks when it goes to a decision such as this that we don't take lightly. I think I speak for everybody. We want kids back in the school as soon as possible. And this information has provided us with a lot of feedback of what that may look like in the interim, as well as, the main goal is getting them all back in there as time allows. So I just want to say thank you for everything you've done to put this together, and your team.
Thank you, Mr. Sutton. Very thankful for the great work that the leadership team has done. We spent a lot of our weekend this weekend calling one another, sending one another various texts. We had some Google Meets this weekend, but it's all well worth it to get the board what they need to make this very important decision. So thank you for the kind words.
Well, and may I also add, I want to thank our parents who have been meeting with principals. They've been in constant communication with us, but our parent advisory councils, our PTAs, PTOs, that they have offered their perspective, and I appreciate the time that they've taken to do that.
Yes, ma'am.
Mr. Chairman, based on the information that we've had today and looking at all the stuff, I'd make a motion that we stay in Plan C for third quarter.
I'll second that motion.
Okay, I've got a motion and a second. Motion by Mr. Carroll, second by Ms. Sessoms. Is that correct? To stay in Plan C for the third quarter?
That's correct.
All right, we have a motion and a second. Any questions or comments?
I make that motion based on the fact that what we've heard today from our staff amounts to a 5-alarm fire, and their ability to be able to try to deliver what we're asking them to deliver. Parents have asked for some consistency. One of the biggest things that I've heard is that, I hate this coming to school, out of school, back in school. It's too disruptive. The education is not occurring. We've heard from our county health department that we are one of the top counties in this state that is being looked at, not only just in the state, but nationally. We are at virtually 17%. Our healthcare system is maxed out in this county. Our staff has asked that they would love some support delivering education, but the support is out trying to cover staff out. So we all understand, and I was back and forth about how could we put some in school and make it work. But we're in a bad shape. We have a vaccine coming. We hope, based on what I heard yesterday, that we're going to have a bigger rollout of the vaccine, making it more available. So hopefully we can get our teachers, our staff vaccinated earlier than maybe we anticipated. And by the time we see the peak finish sometime in the early March, we can have our folks maybe the first vaccination done and follow it pretty quickly. But Plan C is the only plan that we can come up with that gives everybody stability. Everybody knows what we're doing. Everybody can plan for that. Our teachers will, what we've seen here, they've told us we can do better one way or the other. But if we go both ways, our educational delivery is falling off. So we wish every kid could be back in. I do. I've dealt with my 5th grade granddaughter virtually, and she almost divorced me. But it's not easy. There's no good, perfect answer. but we have to look at safety of our staff. What can we deliver as a school system that is a legitimate education? And we've just look at the data that we've had to face when we've not been facing peaks. We haven't been facing the percentages and the numbers that we're seeing now, and look how much trouble we have. So that's the basis of why I think the wise decision, smart decision for the safety of our staff and looking at all the other data is Plan C. Now, there's never been, I think we all understand there's not a great deal of transmission among students. That's not the issue. The issue is our staff, the older folks. And look at the percentages of, what was the age? 25 to 40. That's the highest percentage. So anyway, that is my take on it.
I'd also like to add that my biggest concern is the staffing. Our principals, the vast majority of them, when surveyed, said, and we got those results from Dr. Bracy, that that their concerns were about staffing the schools, and that's why they have requested Plan C. When our boots on the ground, the people who are in charge of that day-to-day operation are telling us that they cannot staff their schools so that school can operate in a safe and orderly manner, how do you ignore that? And especially when they were having these issues in November and December, and our infection rate is much higher now as a county. So it stands to reason that those staffing issues are only going to increase until we get through these surges.
And please don't take my brevity and contrary stance as a sign of disrespect or lack of a formidable argument, but I still maintain that our staff, they deserve a choice. If they want to be there, they should be able to be there. Our students and families deserve a choice. If they want to be there, they should be there. You have virtual, you have that option. Everything in society is funded or is based on a choice, and we have to give these families and our staff these choices. And there are staff who feel unsafe, and there are staff that want to be there. So please don't take my contrary stance as a sign of disrespect or lack of reasoning, but I'm going to vote against that, and I will propose a motion to go back to Plan B in some sense for at least our elementary kids.
And I'm in the same agreement as going back to some form of Plan B. We've had the great Dr. Bracy and his staff have provided the PPE for our schools, and I think they're well prepared to be safe and cleaning products to be safe. I've had numerous emails from daycare owners where students are having meltdowns in daycare and at home trying to do virtual learning. And I'm totally concerned about pre-K through 5th grade. And we can transition to 6 through 12 at a later time due to the deficiency of bus drivers and quarantining, but I would support some type of Plan B as well.
I do as well. I do not support Plan C. Our students need to be in school. I understand the critical situation that we're in. We closed the schools in December, and it did not help. The rate continued to climb. It wasn't because of our schools. And we know that they're not spreaders, but you know, in 2 months, 8 weeks from right now, it will be 1 year since the governor closed the state. And in that 1 year, our students have had some 4 weeks of face-to-face instruction in 1 year. We cannot do this to them. We are responsible for a sound basic education for these students. I agree with a parent's choice. If parents don't feel like their children need to be at school, I am so excited that we have another option. But we have an educational crisis taking place right now in our country and in our county. We owe these children the opportunity to learn to read. We owe them the opportunity for a sound basic education. It's not going to happen virtually. I have witnessed it with myself. Wonderful teachers. Teachers are working so hard. They're doing everything they can do, but I would challenge each of us to sit in on a virtual class in various economic statuses around our county and see that it is not working. It's not working. And our students deserve the opportunity to try to go. And I feel for the staff. I am a teacher at heart, and I feel for the staff. And I understand the challenges that lay before us, but I feel that we have to try to move forward. I am in favor for Plan B. No, the Plan A, I understand in elementary, if I'm correct, we had a lot of kids in classrooms.
Correct.
We can't social distance like that.
No.
But we have been told by the medical experts, if you will follow the protocol, if you will have your space between students, mask, I understand the challenges with that. You know, let's have a day a week for sanitizing the school. Let's do everything we can do. But we have to move forward with educating our students. That's what we've been charged to do. And I understand completely the hard work that has to go. It's easy for me to sit here and say it. I'm not the one who's got to go out the door and do it. But I support those who are going to do it, and I just feel like we have to try it. We have an educational crisis in our country right now. How are we going to make up the deficit? You know, our kindergartners left school in March last year. They did not finish their kindergarten year, and now they are mid-year first grade. They haven't even experienced school yet. And you could go on with all the different grade levels, but I just feel strongly that I support Plan B, and we could talk about the details of it, and certainly we have to get other people involved, but I do not support going completely virtual.
This is probably this is a very difficult decision. It always has been a difficult decision since March. And there's not going to be an easy way to make this decision. Yes, do kids need to be in school face to face? They certainly do. Do we worry about the kids who don't have support at home? Absolutely. Is education changing? Yeah. Are we in a crisis across our country? Absolutely. But I support staying in Plan C until the end of third quarter. We've got to provide some sense of consistency so we can get an idea of what's working and what's not working. And I've said this time and time again, every district across this country thought they had a great remote learning plan until they needed it, which was March. And every district across this country is experiencing the same pains that we're experiencing. They're losing teachers, they're losing students. We're all learning this together, but we've got to provide some sense of consistency. And for me, as a teacher, I could not even fathom going back and forth from remote to face-to-face, remote to face-to-face. I just need some sort of consistency. And I don't think that waiting until the end of Q3 is not a bad idea. It's going to give our district time to plan and give us a logistical plan on Plan B. It'll give us time to get past the peak with the COVID numbers. And it'll give us time to really analyze where we're at.
Yeah, I respect that. I don't agree with that. And, you know, I'll say one more thing. I'll be quiet, I think. But, you know, today I'm riding through our community. Our grocery stores are open. Lowe's is open. Walmart's open. These places are open because they provide a service to us. Let's let the grocery stores close, and we're in a crisis. Would we not be? They provide our food, right? We close the schools. We're in a crisis. And I'm not saying that virtual is closing. I'm just saying other people are going to work because they provide a service to their community. And I know that's not the same analogy, but that's my point is that we have to continue keeping on as best we can. And I understand it's a challenge. I don't make that light of that at all.
Absolutely. But I think the thing that concerns me the most is getting to the point where we were in December, where we did not have enough people in our schools that could staff our schools.
Well, and we have the option, and they did it already, we have the option that if a site, Four Oaks Elementary had to do it, if a site has to go virtual because they don't have enough staff, they go virtual. Did not Four Oaks Elementary do that?
Well, several schools
Yeah,
did that.
I think, I don't know all the schools that did it, but, it was before I got on board, but
Yeah, some before you got on. Yes,
that's an option. That we can send classes home virtual, but we don't have to do it to the entire county.
Yeah, I mean, and speaking from personal experience, you go to some of these impoverished neighborhoods or some of our government housing where our kids are, in some cases, lacking that positive adult interaction, and they've been suffering now for the better part of a year. I mean, going to school and seeing some of these teachers is the best interaction some of these kids have, and they're getting into trouble. And things are happening to them that I contend would not happen if they were going to school and had that positive influence. And Lynn, you are on top of it when you say grocery stores aren't closing. Society hasn't closed down. And I would contend, as everyone in here would, the right to an education is almost as important, if not more important, as the right to food and everything else that this country is based on. So, yeah, Todd, what you gonna do, man? We got like a lot of people watching.
Well, I just want to say, so many good points have been brought up. As Ms. Zukowski said, this is not an easy answer. Our parents have endured the hardships. Our students, it does. As a former teacher, as a retired teacher, it breaks my heart because most of my career was spent in those areas where we had a lot of poverty. There's no easy fix to this. But if I guess what I'm trying to say is that this is not a permanent decision. We are talking about giving our staff the opportunity to recover so that they can come back into work. With the increase in the infection rate, we can expect to have more people quarantined than we did in late November and early December. I mean, we can just expect that. And having had to staff a school, I can tell you we are asking, I believe, not that our folks can't do it. We have the most wonderful employees and educators. But if they are telling us that they cannot operate safely, how do we ignore what our principals are telling us? They are the people having to implement what we decide. And if they are saying to us, we cannot do it, why would we not listen?
Mr. Chairman, I called a question to close this debate and vote.
Yes. Before we do that, Mr. Johnston, I just want to say that I value and respect everybody's thoughts and comments tonight. This is a very difficult decision, and it's one that we all know that there's not a playbook for us to fall back on. And it's a difficult decision that we're making as well as other counties are making. So at this time, all questions and comments are closed, and we'll go to a roll call vote. This roll call vote will be on the motion to remain in a Plan C setting for K-12 through the end of our third quarter. So at this time, I will start with Mr. Wooten.
No.
Miss Andrews.
No.
Miss Sessoms.
Yes.
Miss Zukowski.
Yes.
Mr. Carroll.
Yes.
Johnson.
No.
And I vote no to go to Plan C. So the motion does not move forward by a 3-4 vote.
Mr. Chairman, I'd like to make a motion to move to Plan B, terms to be outlined by the school superintendent at a later date.
I have a motion on the floor to go to a Plan B setting to be outlined by Dr. Bracy. Is that correct, Mr. Johnson?
Correct.
I second that.
I got a motion by Mr. Johnson, a second by Mr. Wooten. Any questions or comments?
To clarify, I believe the superintendent is clarifying with the board attorney now as far as the parameters surrounding to what he can determine.
As far as being under Plan B?
Correct.
Okay.
Yeah, I mean, it sounds like. Model under Plan B is the way I would interpret this after the meeting.
Okay, so I've motioned that with a second, and
Well, why would you alter Plan B? If y'all think they ought to be back in school, then go with Plan B. I mean, well, give me a break.
Well,
I guess
Carol, hold on.
my question would be in regards to like exceptional children or pre-K.
exactly, and those would be the parameters
Those,
that would be
because
discussed.
those situations have been handled differently, whether we were in Plan A or Plan B. Well, really just in Plan B. Am I correct, Dr. Bracy?
They have? Yes, ma'am.
And that would be my concern, was how was those, and then obviously my thoughts were on Plan B that you would have a cleaning day, which is what the recommendations of the principals were.
I believe that under Plan B, last time, exceptional children came back September 28th, 4 days a week.
Right.
Yes.
I just wanted to clarify that because I think we all are in agreement that, and pre-K, was pre-K the same?
Pre-K was
That was
in
prior
there
to my
too.
time.
Yes, ma'am,
Okay.
they were. Pre-K, self-contained EC, yes, ma'am.
And to address some of those parameters and expectations with the preface that I've been nothing but respectful in my language during this conversation. When you go back to Plan B, you want to adjust it based on grade level, being your elementary, your middle, and your high school, and the needs of your children, to answer your question from a minute ago. That's the parameters that we can discuss here and allow Dr. Bracy some flexibility.
The basic issue is parents would like to know what we're going to do, how to plan for whatever schedule we go on. And, so I think we need to, whatever the vote is, whatever plan it is, they have a pretty good idea of what they're looking at in a couple of weeks.
And our transportation department did say that it would be 3 weeks out before they could get a Plan B put together for, I believe it was elementary, am I correct?
Correct. And to my point, you don't want to rush a specific decision tonight. You want to have that flexibility because they're going to need time to adjust the routes. So you want to take into consideration your elementary, middle, and I think we should come to an agreement tonight on what grade levels should go under Plan B, whether it be your elementary, middle, or high. But transportation is going to need time, therefore we have time.
From what I know about transportation and the transportation department, if he's still here, the first thing they could execute would be pre-K through grade 5, and then transition to middle and high at a later date when you had the drivers to do so. But
Chad's still here.
yeah.
Well, let me just, I tend to agree with that. Transportation, Mr. Johnston, I agree that Plan B should be for K-12 at the earliest given point. However, I think that's more critical right now for us to look at, like you were talking about grade levels. I would like to see us, and I can put this in an amendment to the motion if there's an agreement there, but start with our K-5 in a Plan B setting to get them back in the classroom as soon as the transportation department can assist us with the routes and put that in place. And since our middle and high is a little bit more suited for the virtual, I would rather see them stay virtual through the third quarter and bring them back on a clean start of the start of the fourth quarter or the fourth 9 weeks. That would be my suggestion, if that's what we're going to look at based upon the transportation, as well as we could utilize some of our custodians from our high schools and middle schools to assist our elementary schools on those Wednesdays for those deep cleaning days to just give them more manpower to make sure that we have sanitized in a manner that when cohort B comes into the elementary setting, that it is well cleaned and it'll just offer some additional assistance to our custodians on the elementary setting.
And I think historically, when I say historically, we're talking a short time period. We have always started with elementary, or since this has started, we've started with elementary and kind of worked our way up, correct?
So what we did it last time, sir.
Yeah, I say history, the way we did it the time before, which qualifies as history. So I would recommend.
Can we not ask, can we get information? Can we get information from Mr. Holloman right now? I just want to ask about the,
If I could, big picture, you're talking about all grade levels Plan B. So we put 6-12 could start at any time.
What I'm hearing, Ms. Gill, board members, please correct me, is we're talking K-5, Plan B.
So K-5, my proposal could be that K-5, we have got to have till February 1st. That's the last you bring on, except EC and pre-K, who is already set to go. They could go back most any time. Your 6-12s can go back most any time. And then your last phase, because we have to do routing work, would in this case have to be the opposite of what we did before, except your ECs and your pre-Ks. Is that correct? Yes, so it's just going to be, that's what you'd have to do to give them time to be routing while you're running what's already set. Plan B is already set for everybody else. But if you're doing Plan B for the elementary schools, would you be doing Wednesday as your cleaning day as you do with the other Plan B schools, correct?
Yes.
Right. So that would be what we would suggest, is that you
So
can, whatever
just,
you decide, is that
sure.
your last group is your.
Just while Mr. Holloman is here, Mr. Holloman, would pre-K and self-contained EC be ready to come back on Plan B on the 19th?
Yes, sir. Those routes are ready. We would have to do a
Awesome.
little adjustments for those EC self-contained students that ride regular buses, but we have that historical data from when we did it in September. So yes, sir, we can make that work before Monday.
I thought so. And
6-12 those Plan B routes are ready, so whenever.
I from everything I hear tonight, it's the spirit of the board to keep 6-12 virtual through the third quarter. Am I correct in what I'm hearing?
When's the third quarter in?
March the 12th to be exact, and I feel like if we're going to be able to give some grade levels the opportunity
that's a year.
to start back with a clean slate,
You're
then
going-
all
you-
grade levels should be starting
you're going back
with
to a
clean slate.
year.
Yeah.
If you go to March the 12th, that's a year. I mean, that's a year, and they've had 5 weeks of face-to-face instruction. Why are we waiting?
I think
my
that
question as well, Ms. Andrews.
But I thought that was the motion that Mr. Sutton made. Did I hear that wrong?
Oh, I
Mr.
don't
Sutton?
know.
Made an amendment to my motion.
Well, to answer your question, Lynn, is if we don't have enough transportation to drive all of our routes on a Plan B setting for K-12, it would provide us the opportunity to get our K-5 elementary students back into classrooms sooner. And then we could focus on our 6-12 at the end of the 9 weeks. And based upon the conversations I've had with high school and middle school, particularly high school principals, it would be a cleaner break for them. And they feel that they would be better supported from a staffing issue as well as your transportation to move into the fourth 9 weeks. Now, if that's not the pleasure of the board, then we can, we'll decide on that. But my main focus is let's get somebody back in.
Well,
immediately.
elementary is not coming back till February 1st, period.
Correct.
So,
But-
right?
Yes, that's what you all had talked about
Well,
earlier.
that's what they told us.
Under Plan B.
Under Plan B, elementary can't come back till February 1st. Middle and high could start January 19th.
Ms. Andrews, elementary with the exception of pre-K and self-contained
Right.
EC, because earlier in the summer or the late fall, Mr. Holloman already had those routes done.
Right. I understand that EC, pre-K, and 6-12 are ready to go right now. Okay.
Yes.
So if we start that January 19th or whenever the board decides, are you going to be able to start K-5 on February 1st? Is there any hesitancy that you would have what you needed to do K-5?
We feel like we can do that. Yes,
So
sir.
why don't we do elementary and middle?
I don't,
So,
I'm just saying, if you can go back and do it now, let's do it. Somebody make the argument. I don't know. I'm just saying
No, I'm with you.
it's not because of I don't want it to be because of transportation that middle and high did not go back now. Because they're saying they can do it. And EC and pre-K. That's not an issue,
I don't
apparently.
think, no, that's not an issue as far as transportation is concerned. I thought I heard Mr. Sutton say for 612 being Plan C. Did I hear you incorrect, Mr. Sutton? I thought that what we had discussed was elementary. We bring pre-K 5 back, Plan B on the 19th. I'm sorry, pre-K self-contained DC back on the 19th. K-5 back on February 1st. And 612 remote for the entire third quarter. I thought I had heard some discussion of that.
That was what I was saying. I would like to amend to Ronald's motion, but that if it's not gonna go, the motion on the floor, I guess, is Ronald. Are you putting K-12 in the motion for Plan B?
Saying if they can come, I guess the purpose for waiting till March because it was the beginning of a 9 weeks.
Yes, and talking to some high school principals and looking at the survey data, that's what they were proposing. Staying, basically 612 was the middle school was that way too. So keeping them virtual until the fourth 9 week started, but bring our K-5 back as well as our EC and self-contained. I feel like they're very critical, especially our kindergarten through third grade. But all of our kids are critical. But if we had to start somewhere in a Plan B setting, I would say we need to start there.
So in that regards, on January 19th, EC and pre-K would start back to school.
Plan B, 4 days a
Plan
week.
B, 4 days a week. They would go to school. They would be the only students in Johnston County for 3 weeks.
Correct.
They would be the only face-to-face students for 3 weeks.
January 19th.
And then January 19th, K-5 would come back, Plan B.
February 1st, K-5 will come
February
back.
1st, I'm sorry.
Yes, ma'am.
February 1st, K-5 comes back. But we're going to hold out on middle and high school until the end of the 9 weeks.
That's the conversation that the chair had mentioned.
I don't see why we hold out for the 9 weeks, but I'm not.
I don't either.
I don't know.
So I just really believe that if we hold off until the end of third quarter and everybody, it's going to give our district time to be proactive versus reactive, and we can go back with a solid plan.
Right, but we've been in the third 9 weeks 1 week.
I understand that, but
And we got 8 more weeks to go.
I understand that.
It'd be different if we were halfway through the 9 weeks.
I understand that, but the problem is I feel like our board has been very reactionary this entire time that we've been going, and our district staff have done a great job at pulling data, giving us so much information, more information than we have probably ever had since I have been sitting on this board to make a decision. And I think that listening to our principals and listening to our staff is very, very important for the decisions we need to make. We're not in the classrooms. We're not in the trenches. And we have to depend on our staff members to help us make this decision. And they're presenting us with the data. If we wait until the end of third quarter, it's going to give this wonderful staff that we have the opportunity to present to us with the best possible plan that's going to help our students and our staff.
Well, let me ask you this. If we were to do that, Dr. Bracy, what about EC self-contained K through 12 going?
They would come back the 19th.
Okay. I'm just saying though, I'm just voicing my concern. I don't understand why we'd wait 8 weeks to bring middle and high school back when we've only been in it for 1 week. We've been in the 9 weeks for 1 week. Why would we wait 8 weeks?
Because our principals, middle school and high school principals, are saying that they cannot staff the schools to run them efficiently and in a safe and orderly way. I mean, if our principals on the survey had said, we can do this, I'd be behind it 1,000%. But You know, if somebody comes to me and asks my opinion on something that I have to do every day, and I'm the one who has to live with the decision, and I give you my honest feedback, I'm going to feel like I've been slapped in the face if you don't at least consider it.
I understand. In the survey, though, it was asking about Plan C, was it not?
In the survey, principals said they preferred going Plan C for a quarter, third quarter is what I remember correctly. Is
Right.
that right?
I don't
Ms.
remember
Whittington?
Plan B, though, being discussed.
Because they overwhelmingly voted for Plan C. That's what they all.
Right, and it wasn't, yeah.
It was discussed with, all plans were discussed with administrators. Of course, Plan A is not eligible for 612. But elementary had the conversation of Plan A, B, or C. Middle and high had the conversation for B and C. And they all overwhelmingly had asked the board to consider Plan C.
Any other questions, comments about Ronald's, Mr. Johnson's motion regarding Plan B? And Mr. Johnson, can we clarify?
Yeah,
your
clarification.
Is that K-12?
Yeah, be K-12. I would like to give Dr. Bracey the flexibility to incorporate an additional deep cleaning day if he sees necessary, or to implement a planning day depending upon the workload of the teachers based on the attendance. Did you get that, Mr. Malone?
I second that.
Is expanded upon, sir. Motion is to go to Plan B for K through 12 and giving Dr. Bracey the flexibility to incorporate an additional planning day and deep cleaning day if he sees fit within the schedule. Oh, I apologize. Pre-K through 12, yeah.
We have a motion and a second. Are we putting any, in this motion, Ronald, are you putting, so we're leaving it up to Dr. Bracey to decide on the dates of these students to go back to school? Is that what I'm hearing?
No, the flexibility just is encompassing a planning and deep cleaning day. The date would stand as the date previously mentioned.
Is that date February 1?
Correct.
Okay.
Motion is second. I'm going to start a roll call vote.
Mr. Chair, just want to clarify for the record. I believe we're talking about self-contained EC, pre-K, January 19th, K-12, Plan B coming back on February 1st. Am I correct in that, Mr. Chair? Mr. Johnson?
That's fine.
Thank you.
Okay, thank you for that, Dr. Bracey. So we'll start with a roll call vote. Mr. Johnson,
Yes.
Mr. Carroll,
No.
Ms. Zukowski,
No.
Ms. Sessoms,
No.
Ms. Andrews.
Yes.
Mr. Wooten.
Yes.
I vote yes for B, 4-3. So our pre-K and EC self-contained would start back on the 19th, followed by our K-12 students on February 1st. At this time, we will move forward with our agenda, and I'll accept a motion to approve our minutes on December 8th, 2020.
So moved.
Second.
Motion by Ms. Sessom, second by Mr. Johnson. I'll start with Mr. Wooten for a roll call vote.
Yes.
Ms. Andrews.
Yes.
Ms. Sessoms.
Yes.
Ms. Zukowski.
Yes.
Mr. Carroll.
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0. I'm gonna, at this time, Mr. Wooten, do you have a finance update?
No, sir. Mr. Britt will be sharing that with us today. So I'm going to let him share all the good news. I will state that we continue to add to fund balance, mainly because our expenses are a lot less now than normal, and we got some good news with the CARES Act that he can share. But Mr. Britt continues to find ways to save the district money, and he's sharpening up his efficiencies in his departments, and he's just got some good news to share. Thank you, Mr. Chairman.
Ms. Andrews, any update from the Legal Search Committee?
Well, we have interviewed, and we'll shortly make a recommendation for a board attorney.
Very good. I just would like to say that I've been looking from the outside in, and I appreciate all the hard work that the Legal Search Committee has done over the holidays and then coming back in last week to start your interviews. And I appreciate all the time and effort that you've put into this. And it's a very exciting time for us to look forward to that day when we may be able to have our own attorney on staff.
Mr. Chairman, I also like to mention to all the board members that they met individually in groups with Mr. Britt to get the finance update. And we will have a finance committee meeting. That's a public meeting before the next board meeting, somewhere in between in the next couple of weeks. And we'll share with the public all the great news too.
Thank you, Mr. Wooten. Ms. Sessoms, any updates from the Policy Review Committee?
Yes, we will be meeting this Thursday at 2 o'clock. The presentation that Dr. Pierce will be giving us on policies is just an example of the work. And I'm very excited about this new year with our committee.
And I would just like to thank you and your committee for all the hard work. As we transition over to the School Board Association policies, it's been a lot of time consuming and effort put in by your committee, but it has definitely helped us out transition in a way for policies and getting all our policies up to date. So thank you for all of your hard work and the rest of the committee for their time, because I believe these meetings last 2 to 3 hours at a time. So I do appreciate all the thoughts that go into each policy that we are presented on a monthly basis. At this time, we don't have any special recognitions tonight, so I'll ask Mr. Johnston for his advisory appointment to West Smithfield Elementary.
Yes, sir. Principal Derek McNeil of West Smithfield Elementary is requesting the new appointment for Irene McLam for 3 years. That term would end June 2023.
Thank you, Mr. Johnston. I'll let that stand as the motion. And Vice Chair Sessoms, you have one for Benson Elementary.
Yes, thank you. Principal Takisi Dunston at Benson Elementary is requesting a new member appointment for Latifah Nixon for 3 years, term to end in June 2023.
Thank you, Ms. Sessoms. That'll is our second. At this time, I'll do a roll call vote, starting with Mr. Wooten.
Yes.
Ms. Andrews.
Yes.
Ms. Sessoms.
Yes.
Ms. Zukowski.
Yes.
Mr. Carroll.
Yes.
Mr. Johnson.
Yes.
And I vote yes. Motion carries 7-0. At this time, I'll turn it over to Dr. Bracy.
Thank you, Mr. Chair. Mr. Chair, at this time I ask that the board approve consent items 9A1A through 9A1G.
So move.
Second.
A motion by Mr. Wooten, second by Ms. Andrews. I'll start with a roll call vote. Mr. Johnson.
There's a question, Mr. Chairman.
Oh, I'm sorry, Mr. Carroll.
The Microsoft EES agreement, does that cover the programs and the service fee, or is it just these people managing the contract?
That's Ms. Gill's item, Mr. Carroll. I'll ask her to step in.
Yes, sir. Would you repeat that question just one more time?
I guess the question is, at $300,000, does that include the license fees plus, I'm assuming this company is acting on our behalf to keep them up to date? Or is that just paying for the product that we are using?
This is for the support, the product, everything that we use, all the licensures for everything related to Microsoft.
It's Dr. Coates to come in and talk about Imagine Learning.
I'm sorry. A question on the image, language, and literacy contract. And the reason I have a question, it says statistically significant gains in early literacy. And I'd like to know what it is.
Dr. Coates, you and I talked about this. Mr. Carroll has questions about the Imagine Learning addendum.
Okay. Sorry, I was at the other end of the hall.
That's no problem. The question is, in our presentation, it says that this program contract has shown a statistically significant gains in early literacy.
Yes.
Now, so what
For English language
statistically, what is the gains?
I don't have the exact numbers in front of me. We purchase Imagine Learning for our first and second year English language learners in grades K through 5. And we saw last year in the remote environment, and I don't have the numbers, but that it was positive, and we got positive feedback from our principals as far as the impact to learning. So we did not have and we got it for free for all students last spring. So we were able to see it for the first time with all English language learners in early grades, because until last spring when we closed, as you know, lots of vendors gave us lots of free stuff to use because of the crisis. This was one of them. And we got positive results when it was expanded to all the English language learners and not just the first and second years. So we have worked hard to try to find some state funding so that we could purchase it now for all of our English language learners in K2. I don't have exact data numbers.
Is it like 5%, 10%?
I don't know. I don't know. I don't know if there's a number. I don't know if it was feedback from teachers that we've seen positive results, because we don't assess in K2 like we do in 3rd grade, 4th grade, 5th grade, that type of thing.
All right, I would just say then be careful how you present statistically significant says you know something.
Yes, sir. And I'll get whatever numbers I can get for you.
Thank you, I appreciate it.
Sure. Any other questions?
And I don't mean to be rude or ugly or anything,
That's okay.
but if I want to know if we're improving, then tell me how much we're improving.
Yes, sir. I understand. Sure. Any other questions about it? Or for me while I'm in here? Me? And I hate Ashley just left.
Do
Yeah.
this. All right. We're already paying these people $2.4 million.
That's correct.
And you're asking for another $1.5 million.
Yes, sir.
What are, how many do we serve?
Okay.
What are they doing? What per hour are we paying here? How can it go up?
Well, here, there's lots of pieces. First piece is, this is for speech language pathologists, which our goal is to hire our own teachers to have, okay? And we have that. We had some. Last year on our contract, we contracted for 35. This year, we contracted for 38, and we had 23 Johnston County employees, and all this is on your data sheet. Because of COVID, we lost 8 of our own therapists for services in the fall. 8 people. And 3 are on leave, were on leave for the whole first semester, and 5 were on accommodations to telework. And in some situations, speech language services can be provided electronically. In other situations, it's not as effective. So we also have to provide a portion of the private school service plans to students in private schools, and that is 36 kids this year. In addition to that, the hourly rate for those that we contract with increased. So we had the contract covered to meet the needs.
What is the rate?
It's in here. The hourly rate went up from $54.50 to $56.49, $2 an hour, $23,000 a month increase. Now, we put a bid out for this, and we're still, the next bid was $65 an hour, so it's well below that. And we have tried to hire people. We have interviewed, Ashley Rafford's team has interviewed and offered 8 positions, and all 8 declined our offer because people who get these degrees make more money working in the private sector than they do in the public school system. And in addition to that, this recent legislative decision that people hired after January 1st don't get health insurance as part of their retirement package hurts all those things. Now, these offers were offered in the fall. They've not been offered since school started. So we have to provide the services. So the other thing that impacts this is because of COVID and because of closure. When we have a speech language pathologist at a school, they can serve a lot of kids back to back to back to back. When they're not in school and some are here and some are there and you've got to travel, you can't serve as many students as you normally can. Ms. Rafford has worked hard to get our budget down. She has reduced a lot of other contracts to help pay for this, and she's put, what we can utilize with contracts we did with money left over from other contracts, what we would transition for the private school plans, and what we can take from PRC 132, also some Medicaid funding. But the bottom line is we have to provide speech language services to these kids based on their IEPs.
Thank you.
We're basically spending $3.9 million for 2,407 students.
We wrote the contracts that it would not exceed that amount. We're seeking board approval for that amount if it's less than that amount, but it would not be more. But yes, those are the students we serve.
It's the potential. $3.9 million for
Yes.
2,407 students.
Yes, because we cannot hire our own speech language pathologists. We've offered 8 positions, and all 8 people declined them to work in the private sector.
And it's salary driven totally, right?
Yeah,
As far as-
well,
yeah.
I suspect that COVID had part of it, but I would think salary is the main reason, and a lighter caseload. You have a lighter caseload in the private sector than you do in the public school system when you provide these services.
Any other questions or comments regarding the consent items?
Nurses, do we have how many nurses we're gonna get and how much it's gonna cost?
Ms. Roberts?
That is not my
Yes.
department.
Yes, sir, Mr. Carroll. We are looking for an additional 4 nurses, and this contract is worth $186,000.
Thank you.
You're welcome.
Any other questions? If not, we have a motion and a second. I will start with the roll call vote. Mr. Johnston,
Yes.
Mr. Carroll,
Yes.
Ms. Zukowski,
Yes.
Ms. Essems,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0. See. At this time, looks like we got Dr. Pierce
Good evening, Chairman Sutton, Lady Vice Chair, Ms. Sessoms, and Dr. Bracy, members of the board. I have 6 items for approval. These items were brought for you for information at our last board meeting. Board Exhibit 9A3, which is Policy Code 1000. There have been no additional revisions since being presented for information, and so it is the recommendation of the Policy Review Committee to adopt Policy 1000, and it is presented for approval.
I'll entertain a motion to approve Policy 1000.
So moved.
Second.
Motion and a second. Roll call with Mr. Wooten,
Yes.
Ms. Andrews,
Yes, sir.
Ms. Sessoms,
Yes.
Ms. Zukowski,
Yes.
Mr. Carroll,
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0.
Next is Board Exhibit 9A4, which is Policy Code 1010. No additional revisions have been made to this policy since being presented last month, and it is the recommendation of the Policy Review Committee to adopt Policy 1010 as it is presented for approval.
All right, I'll entertain a motion for Policy 1010.
So moved.
Motion
Second.
by Mr. Johnson,
Second?
second by Ms. Andrews. Mr. Wooten,
Yes.
Ms. Andrews,
Yes?
Ms. Sessoms,
Yes.
Ms. Zukowski,
Yes.
Mr. Carroll,
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0.
Next is Board Exhibit 9A5, which is Policy Code 1320 and 3560. This policy has had no additional revisions since being presented last month as well, and so it is the recommendation of the Policy Review Committee to adopt Policy 1320, 3560, and is presented for approval.
All right, I'll entertain a motion for 1320 and 3560.
So
for
moved.
approval.
Second.
Motion and a second. Start with Mr. Johnson.
Yes.
Mr. Wooten?
Yes.
Excuse me. Mr. Carroll?
I've been called worse. Yes.
Ms. Zukowski?
Yes.
Ms. Sessoms?
Yes.
Ms. Andrews?
Yes.
Mr. Wooten?
Yes, for the second time.
I vote yes. Motion carries 7-0. Pardon me for that miscalling of names there, sir.
Board Exhibit 9A.
You gave him a compliment.
Board Exhibit 9A6, Policy Code 1510, 4200, and 7270. This is the same policy that was presented last month. There have been no additional revisions made since being presented for information, and so it is recommended that for approval from the Policy Review Committee, presented for approval.
I'll entertain a motion for Policy 1510, 4200, 7270.
So moved.
Second.
Motion and a second. Start with Mr. Johnson.
Yes.
Yes.
Mr. Carroll, Ms. Zukowski,
Yes.
Ms. Sessoms,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0.
Board Exhibit 9A7, Policy Code 1760 and 7280. This was a new policy, and no additional revisions have been made since being presented for information, so it is recommendation of Policy Review Committee to adopt 1760, 7280, and it's presented for approval.
I'll entertain a motion for Policy 1760, 7280.
So moved.
Second.
Motion by Ms. Andrews, second by Mr. Johnson, starting with Mr. Wooten.
Yes.
Ms. Andrews,
Yes.
Ms. Sessoms,
Yes.
Ms. Zukowski,
Yes.
Mr. Carroll,
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0.
Then the last is Board Exhibit 9A8, and it is Policy Review Committee meeting dates. Earlier in the year, I set dates based on who are members, since we have new members on the Policy Review Committee. The Policy Review Committee consists of 4 board members, which will meet monthly to develop and review policy for presentations to the board. These dates will go up beside our boardroom, and this serves as our public information and media notice, and is presented for approval.
I entertain a motion for the policy review committee dates.
So
So
moved.
moved.
Second.
Motion, I believe, by Ms. Sessoms, second by Mr. Johnston. Start with Mr. Wooten.
Yes.
Miss Andrews.
Yes.
Miss Sessoms.
Yes.
Ms. Zukowski.
Yes.
Carol.
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0. Thank you, Dr. Pierce. At this time, we'll call back up Dr. Coates.
Thank you, Chairman Sutton. Good evening, everyone. Madam Vice Chair, Board members, Dr. Bracy. Tonight, there are two items from my department. First is Board Exhibit 9B1. As you have had some brief updates, we are working on a math curriculum adoption for grades K-12 math curriculum. And I've asked Chairman of that committee and our Director of Curriculum, Ms. Leanne Daughtry, to present you an update on that process, how it will be selected, how teachers are involved, et cetera, et cetera. So at this time, Ms. Daughtry.
Thank you, Dr. Coates. Good evening. I appreciate the opportunity to be able to talk to you tonight about the update regarding our K-12 math core curriculum. So what is core? You can see on this slide, this is the North Carolina Department of Public Instruction's multi-tier system of support definition of Tier 1 core. So on this you see, as it pertains to core curriculum is one aspect of that. And they've specifically outlined that the core curriculum is to be aligned to the standard course of study, which is, as you know, established by the North Carolina State Board. It is our responsibility as a school district to ensure that every student have access to Tier 1 core curriculum. So what is core curriculum? You can see from this graphic that core is that blue tier there. It's the content that all students have access to. It's evidence-based, aligned to the standards and student needs. We're all familiar with that term curriculum. On this slide, you see the big bulk there is everyone. There are tiers 2 and 3, which are for intervention or acceleration for when students need additional instruction or curriculum related to core. We currently, as you guys know, because you adopted it last year, some of you are in here, we have an ELA core curriculum. We currently do not have an ELA core math elementary through high school core curriculum. We have an interventions in place for math, Tier 2 and Tier 3, Dreambox and Do the Math, and we have ELA interventions for Tier 2 and acceleration for Tier 2 and 3 as well.
May I ask a question? I'm not sort of familiar with your diamond there. Tier 2 and 3, when you talk about enhanced supports and advanced supports, that's not an AIG movement, is it, or is that an AIG education?
AIG instruction does fall in that rhombus in a different tier. And so there are additional structures in place for curriculum for that. We do have those in place for mathematics, and I think that might be, it's the next item for AIG curriculum for math. But the core curriculum is what we're in the process of adopting, and that is what all students get, that grade level content instruction.
So that right-hand side would be for students that are maybe further ahead. Is that what they're saying?
Yes, sir, on the right side of the rhombus, that Tier 2 and Tier 3. And likewise, on the left side of the rhombus, Tier 2 and Tier 3 would for students who need additional instruction, interventions to catch up, to have access to core. This process started back in the summer, actually in the spring of 2020, just as we were going into the beginning of a pandemic. We started math curriculum adoption. And so these first beginning bullets for our timeline outline the work that was done at a central level before the curriculum options were narrowed down. Historically, this has been done at the state level. That responsibility now falls on districts. And so I think that's an important piece of our story. Another piece of our story that's important is this is a 5-year curriculum adoption plan. Our current situation is real. The learning environments, blended, face-to-face, remote, is real, but that is not a permanent situation. So as we're looking for core curriculum, we are looking for a curriculum that will fit all of those instructional environments. Materials for face-to-face instruction, as well as a blended, meaning remote and face-to-face, as well as completely remote access to technology that has not historically been doubted as a textbook. That's why we call it a curriculum adoption versus a textbook adoption. It's very important that as we make these decisions, that we do look at adopting a curriculum that is quality based on the research in mathematics. And we used a research-based rubric to make those decisions. An example of our rubric here is here. I know that that's really small. I cannot see it on my 40-something eyes, but that is hyperlinked in the presentation. So if you click on that image, you can see our full rubric and blow it up and see it at a larger font. The non-negotiables, the things that are most important here on this rubric, are that it's aligned with the standards for that grade level, that it aligns with the standard for mathematical practice, which talk about the habits of mind and skills that students, mathematically proficient students, have and are able to do. We look at focus. The standards are written such that at every grade level, there are certain standards that have priority or focus and have more weight. A curriculum has to mirror that. So we have to see that those big ideas are given more instructional time at that particular grade level. This next non-negotiable is a big reason for having a core curriculum as we're thinking about coherence. Coherence means that the concepts are interwoven and taught together in a way that makes sense and makes this math come to life outside of the math classroom in the real world. It also means that within that grade level, those concepts are coherent, but within that grade span, those concepts need to be coherent. And then beyond that grade span. This is a big piece that we're missing right now with not having a coherent curriculum, is that as we shift from elementary to middle to high, we need to make sure that we have those same principles, that same instructional guidance happening so that learning is coherent for students, not just chunked for this year and then this year and not seamless. And then lastly, our non-negotiable dealt with rigor. Are the tasks worth doing? Are they real world? Are they meaningful for students? And then is there a balance between skills practice, thinking mathematically, and then making connections to concepts so that students aren't just memorizing facts and forgetting them, but that they're learning concepts at a deep level. This slide outlines the administrative and teacher involvement in the curriculum adoption. As you can see there, in December, we had a vendor fair, and because of COVID, it had to be virtual. So we created a site that educators could log on, ask the vendors questions about the curriculum, learn more about the curriculum and the materials that they would be getting as a result of this curriculum adoption. Then in January, right now, we're in the middle of our professional development for having a pilot of the curriculum. I've been in this district in a central role, different roles, for over a decade, and this is the first time we've had a pilot at this scale. I'm very excited about the opportunity for teachers to opt in to being a part of the pilot, to get a very different level about the usability of the curriculum. And I'll share some more about the pilot in some later slides. And then our goal is that in March, we will have all the teacher feedback. We will have feedback from pilot teachers. We will have feedback from other administrators who want to give, other educators who want to give feedback, coaches, administrators, and that we will make a decision using a Trago Ed decision analysis from all the data that we have. A decision will be made in March. This slide just gives a little bit more information about educator input on information and input on the curriculum adoption. You can see things like meetings with principals, sharing information and updates through grade-alike meetings. You see I've met with the Teacher Advisory Council group to discuss question and answers about the curriculum or the pilot. You see that, or the virtual vendor fair, the pilot teacher professional development. We've got PD all day tomorrow for teachers who are, high school teachers who are participating in the pilot. And then you see that in January and February, I'm working on creating professional development. We know that in order for curriculum implementation, the research says that we have to support teachers with professional development of curriculum. So I'm starting to design those modules now for implementation, and those will be live in a Canvas course in March, starting in March, but it'll be ongoing through the summer and next year as we implement a curriculum. So these are the curriculum options that will be piloted. In elementary, you see that there are 3 curriculum being piloted, 3 curricula. In middle school, there are 3 options, and in high school, there are 4 curriculum options that are being piloted in our schools. Just a little bit more about the pilot, because it is kind of new for us in our district. The pilot participation was completely optional. Teachers opted to teach, to be a part of this pilot. They're going to teach 1 unit of the curriculum and give us feedback regarding the usability of it. How did students respond? Did you have the materials that you needed? How easy was it to teach in a virtual environment and a face-to-face environment? What changes would you make? That information is good for us to have as we're making a decision about the curriculum. That will be a part of the Trago analysis. But it's also really good information for us as we think about and anticipate planning professional development for teachers as we implement a curriculum. Here's a little bit of data about the number of teachers that are involved in the pilot. You can see there are over 180 teachers who are going to be teaching this. We had a lot of interest. You can see the breakdown by grade level, the breakdown by elementary, middle, or high there. We do have, Math 4 is a brand new course this year from the state. So we are excited that two of the options have a Math 4 option. And so we do have those pilots of both of those in that brand new course this year. Lastly, I just have some links there that might be of interest to you if you were interested in seeing our rubric or learning more about the timeline. The standard course of study, of course, is linked there if you're interested in that, as well as the NC check-ins, which you may have heard a little bit about. I've been encouraging teachers to look at that when they're looking at the alignment of the curriculum, just so that we make sure that we are choosing the best curriculum option for our teachers and for our students in our district. That's all that I have. Do you guys have any questions?
Did the company, who's doing the PD for them, for the pilot?
For the pilot PD is from the actual company representative. So the curriculum specialists from the companies are doing that. Members from CIA are sitting in on that and, you know, giving feedback as we need, but that's coming directly from the curriculum specialists from the
And
company.
so when a curriculum is adopted, you're obviously going to need to do some pretty massive professional development. I know that costs money. Is there a plan? I mean, you're just going to wait and see.
That will be a part of the curriculum. So once a decision is made, then that becomes a part of the proposal that we will be back in the spring presenting to you guys. You're right, it does come at a cost. We, for ELA, have been doing some of that in our office for professional development and sustaining and implementation of it. But usually there's an initial launch of a curriculum.
But it would be possible to get a staff member trained in that at some point, or depending on what you select?
We absolutely will need folks from the district office, teacher leaders to step up and to be implementing, you know, supporting that in our district, especially with a district our size. Scale becomes an issue. So how do we scale up when we have, you know, the staff that we have? How do we maximize that? We've been doing that this year with ELA and supporting ELA teacher leaders. Last year we did an ELA teacher leader cohort, as well as all teachers who taught ELA came in for professional development. But That's my hope, that with these modules that I'm launching in the spring, that we will start that with teacher leaders to plant some seeds that need to be, that we all need to be on the same page about why we even need a core curriculum. It's been a long time since we've had a core curriculum, especially in high school math. So planting the seeds for that with teacher leaders and then supporting that with implementation, especially in our environment. I get emails all hours of the day and night from teachers saying, I'm nervous about piloting this in a remote environment. Yes, we are, but we're doing this, and we're going to do the best we can, and we're going to support you through that. So we're doing check-ins and office hours with pilot teachers to support them with that pilot implementation.
How are teachers responding to the transition between this and investigations?
So during the vendor fair, there were quite a few teachers who had questions about, how does this align with investigations, or the games, which are a part of the investigations that build fluency. Most of the curriculum have some games, so teachers are looking for certain things that they like about the current curriculum, as well as looking for some of the things that they wish that our current curriculum in elementary had, more practice, something to bridge that big, heavy conceptual work with translating that into how does that look for, say, a standardized test.
I'm assuming that we probably talked with other systems that have used this curriculum and to get a little feedback from them about how did it improve the scores? Did it do a good job? Do we have any information like that?
So we definitely, so there are a couple of different sources, groups out there that vet curriculum. There's one called Ed Reports, and they run through and they make sure that the curriculum is sound, and they have rubrics that they run through.
But what about people that are actually using it?
Right, so districts, so in North Carolina, I'm a part of two different math teacher leader or district leader cohorts. One is what used to be known as the Triangle High Five, which is now the North Carolina Math Collaborative, and then there's the large district math collaborative. We're constantly sharing resources, we're sharing ideas, we're sharing curriculum and data that work. Yes, the conversations that we have are, can you match us with a district that looks similar to us with demographics that's using your curriculum? So they all have provided data. We definitely will figure that into our decision analysis. What effects do we have? These are all research-based curriculum, meaning they meet the content, and they all have their independent studies that show results. When we get to that part and making that decision, that definitely can be some data that we share.
And I know this has been going on a little bit, but how much is this going to cost us? An estimate of this, and I think Ms. Andrews makes a big point. Staff development is a big deal, and it costs money. So, if we buy the program and don't invest in the development, I've found over the past that it's not a good deal.
Mm-hmm.
So, can you give us an estimate?
Sure.
I'll be glad to do that one. First of all, we won't get to the financial negotiation stage until we determine what we want to negotiate for. I can give you the history on English language arts. We started negotiating on English language arts, and it took a couple of months, or not even a couple of months. We started negotiating, and within a month had a recommendation. Part of that did include the PD, but what we learned very quickly was our PD was better, and our folks will tell you that our PD was better. We even have one of those companies doing videos in our classes because of our PD being so great. And it was done by everybody in our CIA department. So part of the PD will be included in that purchase price. Then what we have historically done is picked it up ourselves, as she said, with teacher leaders, and done it on our own if we have staff to do that. And we will be talking about that realignment and restructure, in the next few weeks, I'm sure, with Dr. Bracey. But what we have found is that, and this is feedback from the ELA adoption, is that our teachers said that our PD was better for them. And the way we did that PD, we did an initial rollout. We didn't do like we used to do, is pull everybody in, train them, put them in school and do the best you can. We had staggered PD, we had support sessions. The English language arts was so complex that we did the first rollout was whole group instruction. The next rollout this year is a small group instruction. How to incorporate writing, did it in stages. We would do those very same things. Now, the difference, of course, in English language arts and math is so skilled, developmentally built. So we will have that initial rollout, and then we will provide support sessions and have periodic PD all through the year for that. What it's going to cost, I can't predict it, because that will be part of the purchase price, which we've not gotten any prices until we start seeing which one we want to. We just don't have the staff to negotiate 4 curriculum prices, and it'd be more than 4, because we'd have to negotiate at every level. So we're going to wait till we decide on the choice we want and then start negotiating price. The way we paid for English language arts, we couldn't afford it all at one pop. So what we did within our central CIA organization, we cut a lot of programs. We did a program evaluation. We cut a lot of things that were not being used effectively across the district to save some money there. And then we negotiated payment over two years. So the purchase price was split up over a 2-year period. And so we negotiated in the spring for a price that would not begin payment until after July 1. And this year is the last year of that English language arts payment. So we will not have that after this year, so we feel like we can slide into the math curriculum payment and be able to provide curriculum to our teachers who sorely need it.
I understand, but there's got to be, we have to have some sort of idea of what are we going to, $500,000?
I know what the English language arts curriculum costs. We paid, we adopted K-12 and we paid $2 million a year for 2 years. Isn't that correct? 2 million. We adopted an elementary and a secondary. And the elementary, each one was $1 million a year. So we spread that out over 4 years, and we also at that same time, and I can pull those exact numbers for you, I just don't have it in my head, but at that same time, because our math interventions were woefully lacking, we could get our math intervention from one of those companies at a reduced rate. So we purchased the math intervention too, and I think we owe less than $300,000 in year 3 for that. That's the only thing we'll be paying for next year is the math intervention.
I'm just trying to get a comfort that we're, ballpark of where we're headed.
I can provide for you, in fact, I can find it and email it to you probably, but I can provide for you the math payment schedule and the time and all of that. I'll be glad to pull, the English language arts one historically, if that helps.
I just, financially, I'd like to know what we're fixing to spend a lot of time obligating ourselves to.
Right.
Because we go through all this, and at the end, we need to know where we're going.
I understand.
And I don't know if you know, do any of these companies that you're looking at to select from require that they do the staff development?
I don't think.
Some companies have done that because
they
don't want their product to go out there and not be done right.
So 2 of our options were released as open source. So free, I say free because free is never really free, curriculum. And with that stipulation was that the professional development had to be offered by the company. But that is in the process of changing. They're changing their ways of doing things. Different companies have purchased that curriculum and have added to it. So I don't think that we'll find ourselves in that exact situation like we have with mostly those, I think, fall with like intervention or very specialized population curriculum.
Remember years ago, language fell under that.
Mm-hmm. Any other questions? Right. Thank you.
I just wanted to thank you for putting together such a comprehensive PowerPoint. It made me dig deeper into some of the curriculums that you're looking at. It's where my heart is, and so providing all those links gave me good reading material for the past week, so thank you.
All right, thank you. Right, thank you.
The website is still active too. You can access all this from that website. The second and last item for me is Board Exhibit 9B2. As she mentioned, you asked a question about the tiers with gifted learners. In 2012, in this district, we piloted and purchased Project M3. It's called M3. It means Mentoring Mathematical Minds. That was an AIG resource at that time. And then as the district moved more toward innovation, the requirement to utilize that, I think, kind of left, and schools had options. But anyway, now that we're back more of a focus on student achievement, teaching, and learning, and during that time, I don't have to tell you, we had a lot of turnover in our school leadership and from school to school to school. Several of our elementary schools have said they just don't have the level of volume of that resource that they need. So we just reached out. What do you need? What do you have? What do you need? What do you don't have? What do you need? So since the original 2012 adoption of it, or not adoption, but purchase of it as a resource, it's not the curriculum, it is a curriculum resource for gifted learners. As Ms. Daughtry explained, all our kids have to have the core curriculum, and then there's additional support. We need to expand this. They've added an online component, or digital component called Flourish. So this request tonight is to purchase this resource for the schools that need more. Some schools have some don't. Purchase this resource at a cost of $98,278.60. This would come out of AIG funds, which we have. It includes student mathematician journals, as you can read, teacher guidebooks, and then 3-year ebook licenses. This is in grades 3 through 5. So it's not a new resource, but it is a resource that now that we're focusing more on our MTSS curriculum chart and making sure we're meeting the needs of students, we need to expand its use. So I ask that you approve the purchase of that updated resource.
This is an action item for the Mentoring Mathematical Minds curriculum resource. So at this time, I'll entertain a motion to purchase this curriculum resource.
So moved.
I'll second, and I assume that we've got it correctly budgeted and we're good. You know,
Yes.
we've been letting a lot of money fly today.
This is out of AIG funds. We have the funds to purchase it.
We have a motion by Mr. Johnston. Do I have a second?
Mr. Carroll, second, I believe. Did.
Yes, I second it.
Okay, thank you, Mr. Carroll. Any questions or comments?
Anything that we can do to assist our AIG students, I'm thrilled that we're putting money in that direction. Thank you.
Welcome.
Can I ask, how's AIG delivered now?
AIG instruction is a support instruction. It is our teachers, and before COVID, we have asked that we offer, I don't know the right word, clemency is not it, that we are more flexible with how students are placed because of COVID. In a regular life, our students would have to have, our AIG students would have to be taught by an AIG certified or AIG endorsed teacher. We've run into roadblocks with that in our district because in our previous AIG plan, the certification process took 6 years, which is just, can't do that. You can get a master's degree in 2. So we have shortened that, written some different Canvas courses to make it now a 2-year process. But because of the separation of face-to-face and virtual, we have requested through Dr. Bracey that we can, for this year, schedule some students apart from those teachers that are certified, provided they are meeting their needs, which is another reason for purchasing this resource. So they are served. They're grouped based on the school board plans for grouping, school board policies for grouping, and then they receive the core curriculum instruction and then more instruction, not extra instruction, but more in-depth instruction at a more rigorous and gifted level based on their individual needs.
Would that be moving into a different classroom with the
It
AIG
depends.
instructor?
It could be. Well, sometimes it is and sometimes it isn't. We no longer have a separate pull-out model, but we do have situations where, for example, if a student in 2nd grade is really gifted in reading, that student might go to a 3rd grade reading group for some of their gifted instruction. But as far as a standard we don't have a standard program for pullout. It's based on the needs of the student. And as kids get older, it moves more toward course selection than differentiation within the core curriculum.
All right, so we have a motion and a second. Any other questions or comments? If not, we'll go to roll call. Mr. Wooten,
Yes.
Miss Andrews,
Yes.
Miss Essems,
Yes.
Miss Zukowski,
Yes.
Mr. Carroll,
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0.
Thank you.
Coach. Miss Gill.
Good evening again, Chairman Sutton, Vice Chair Ms. Terry Sessoms, members of the board, and Superintendent Dr. Bracy. I have 2 items for you. One of those items was adjusted when we had the beginning of the meeting. And those are both for action, and then there's an information piece on it. So the first item is Board Exhibit 9C1, and this is very exciting. This is the naming of the new elementary school in the Thanksgiving area. I'd like to give you a bit of small history about the Thanksgiving area. Thanksgiving community is a small area along Highway 42. Northern Johnston County gets its name from the long-standing Baptist church. On Thanksgiving Day in 1899, a group of people in northern Johnston County met and formed the church. They began meeting in the ARP schoolhouse until the new church could be built. The members worked tirelessly, sawing and dressing local timber donated by the ARP family to build the church. In August of 1901, the church was finished. In 1940, Raymond E. ARP donated 17 acres of land for additional church grounds and a cemetery where the church is located. In 1961, the ARPs donated the land for the Thanksgiving Volunteer Fire Station. The property for the new elementary school was purchased from the ARP family. They would like us to consider, and that will be a separate item to talk about after this first approval, naming the media center after the late Raymond ARP. So Johnston County Public Schools prides itself on our community schools, and naming the new school Thanksgiving Elementary School would be a fitting addition to the Thanksgiving community. So I'd like to present for action recommending the naming of the elementary school Thanksgiving Elementary School in accordance with Policy 2810. I bring that to you for approval at this time.
So moved.
Second.
So we have a motion and a second. Motion by Ms. Sessom, second by Mr. Johnson to accept Thanksgiving Elementary School as the new name of our elementary school. Any questions or comments? Any questions or comments?
There are none, sir.
Okay, thank you. I was frozen there for a second. Thank you, Mr. Johnson. At this time, I'll start with a roll call with Mr. Wooten,
Yes.
Ms. Andrews,
Yes.
Ms. Sessoms,
Yes.
Ms. Zukowski,
Yes.
Mr. Carroll,
Yes.
Mr. Johnson.
Yes.
I vote yes. Motion carries 7-0.
An information item I'd also like to add is, as per Policy 2810, we would like to recommend that the School Media Center be named for the late Raymond ARP, but this does require 60 days for review, and I'll be bringing it back, and that is a typo in the March meeting. And during that time, we'll also bring you some additional history pieces as well, and the family would appreciate that consideration. All right. My next and final item is an exciting one, Board Exhibit 9C3, and this is S2 software project, and it was funded by a grant that we won, the 2020 COP School Violence Prevention Program. I will say that Dr. Cherry Johnson and Mr. Chase Farrell worked in collaboration to submit this grant, and I'm going to talk to you a little bit about the grant as well as what S2 software does for our district. As you know, Chase serves in my department as our safety and auxiliary officer. He oversees all of the safety operations within our school district. And beginning about 3 years ago, we did have a phased process of enhancing our security. And the controlled access is part of that. So I'm going to talk to you just a little bit about what that is. But Johnston County was the only district in the state to be awarded this grant from the Department of Justice in 2020. And it's a $100,000 grant written by the county's Director of Grant Research, Dr. Johnston. And it allows principals to lock down and secure all doors at their site during a crisis event at the stroke of a button. The measure allows schools to be locked to anyone on the school's exterior in seconds during a crisis event. We have district access control personnel and other district leadership staff who have the capability to deactivate key fobs and student ID cards at any of our S2 sites. Basically what this means is if a student has been suspended or expelled and is not supposed to be on any of our properties and they are holding a card, that is deactivated remotely. And then in the event of crisis, we can manage those buildings, which you know in our schools we have many, many different access points. So the software identifies doors that are propped open for an extended period of time, and that is sometimes an issue. It details the names of the key fob and student ID holders as they enter the door, creates a record for that. And currently we have schools that are having this access control in our high schools, North Johnston Middle, Swift Creek Middle, Clayton Middle, Powhatan, Four Oaks, Pine Level, and Cooper. This grant will allow us to outfit Archer's Lodge, Riverdale, Meadow, Micro, Polenta, and Princeton with these S2 capabilities. Because this is a over $90,000 expenditure, we wanted to bring it to you this evening. You will also see attached a letter from our sole source, the person who's been working with all of our S2 software, the company being North Carolina Sound. I'd like to bring that to you for approval this evening.
I'll entertain a motion to accept the approval of the Safety Software Purchase Grant Award.
So approved. Second.
Motion by Mr. Johnson. I'm not sure who the second was.
Bukowski.
Ms. Zukowski, thank you. Any questions or comments?
Yes, how many schools are not going to be controlled after this?
I'd have to sit and add that up, but all of our high schools is 8. This probably puts us well over half. Let's see, we have 45 schools. Let's see, 8.
Is there potential with all this?
Yep, it's actually going to be, it'll be half.
All right, is there potential with the CARES money or all this new federal funds for COVID that is a potential use to outfit all of our schools with this that would
Mr. Britt with us virtually yet?
Stephen is on virtual.
Yes, I'm here.
We were just wondering, Mr. Britt, the question that's before us is, would any of our CARES Act funding that we have gotten during this situation, would it be a permissible expense to finish the last of the 22 schools with S2 controlled access software?
It may be. I would have to check the chart of accounts from DPI for the allowability of it, but it's very possible.
The grant's for $100,000, and it looks like we are doing make 10 maybe. Yeah, so as we've brought schools online in new construction, we have done it, and then as funds allowed, we've been, for lack of a better word, piddling at it. And this is our biggest time that we've gained some momentum. We would like to finish this because it's a powerful tool. I will say that, we redeveloped a job description from a locksmith we have, who now works doing nothing but controlled access, key fobs, and manages that whole piece. So this automation is just a game changer for us and helps.
I would like for us to find out how many we need to do, and if CARES money does it, we should do it.
I was just going to say, Mr. Carroll, Miss Gill, Mr. Britt, and myself can figure that out, and in Mr. Wooten's next Finance Committee meeting, we can have that on the agenda and have those expected costs for those tasks.
Thank you. And one final note is just to let you know that we did do a press release on this back in the early fall, because this was just a fantastic grant that we were awarded, and a bit of good news. So we like good news. My items have been happy today, I hope. Point of things.
Mr. Malone has a.
Yes, sir.
point of order.
Mm-hmm. Mm-hmm.
What the document that you attached says that the equipment itself is sole source, but it sounds like there are multiple vendors that can provide it. So are you bidding it among the vendors that can provide it? Or are you asking to use just the installer? Because I don't think that's sole source.
Right. I would have to clarify that for you, because I'll have to go back to the way we have managed that from this is the first time we've been using the same vendor, but we've never been in a situation where we're at this high of a threshold. So, I do believe, Stephen, that I think we reached out to Tabitha to ask about how we wanted to handle that. So honestly, I would have to get clarification as to how to proceed forward to ensure that we're doing it correctly.
So the board's approval could be for the equipment at the dollar amount and give us some flexibility to make sure that we don't need to bid it among the vendors that
Mhm.
install it, just in case it includes us required. That would be my preference. So we wouldn't hold it up if we needed to bid it.
Sure, we're amenable to do whatever it is that makes this work in a good way for us. North Carolina Sound does many of the things that we do as far as bidding and working with us as well. Mr. Britt, we could collaborate on that and ensure that we're following all the processes, but do we need to adjust how we make this approval
How about I
based
make a
upon that?
motion that we authorize up to $100,000 to outfit these schools, contingent upon, if there's a bid process necessary.
Sure.
That is done, and if it's not, move ahead.
Okay.
Now, Mr. Carroll, if there's a bid process, could we also, if we bid it, could we include the other schools too, to go along in that bid process when we get to our finance committee?
Well, if they've got the money to move ahead with this, I would think that we would come back with the rest of the schools and authorize that, and I would say move ahead with that. But, with this authorization up to $100,000, they can do whatever it is they need to do and move on. We don't have to mess with it again.
All right, and we'll put some things, once we go through this process, we'll also put some things together for finance as we proceed with the latter 22.
So, Mr. Malone, did I hear correctly that we're going to amend the motion to what Mr. Carroll said? Is that what Mr. Carroll is stating? I think Mr. Carroll's motion works really well, and that'll allow Stephen and Doris and others and me to just kind of make sure we are applying this exception correctly. I mean, clearly we can just order this equipment. I'm just not 100% clear about getting it directly from North Carolina South. So
Sure.
Okay, that sounds good. So do I have a second to Mr. Carroll's motion? Yes.
You, sir, it's Brooks Moore.
Is it, Brooks? Hi.
If I might could add a little bit of info on the sole source piece. The S2 is a digital software network that we purchase that operates all of these systems, and NC Sound is a certified installer in this area of that software components that add to this network. So for warranty and functionality's sake, S2 company is not going to allow a non-certified installer to install components to their system. So that's why they're our sole source vendor.
Brooks, I don't want to argue with you tonight, so let's just talk about it after.
We all have spirited conversations over in facilities. We love Mr. Malone, don't we?
No problem.
We're gonna make it work. We're gonna do the right thing. You see why we have a Brooks Moore. He always comes in at the greatest time.
All right, so we've got a motion and from Mr. Carroll. Mr. Kowski, do you continue with your second?
I do.
All right, we got a motion and a second. At this time, I'll do a roll call vote, starting with Mr. Johnston,
Yes.
Mr. Carroll,
Yes.
Ms. Zukowski,
Yes.
Ms. Sessoms,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0.
Thank you. It's a pleasure. That's all I have.
All right, invite Mr. Vetrano back in.
Well, we got Mr. Britt next on the
Oh,
agenda.
I'm sorry.
So Mr. Vetrano
I
can step
apologize,
in
Mr. Britt.
after Mr. Britt finishes.
Mr. Britt, thank you for joining us tonight. I'll turn it over to you.
Good evening, board members, Dr. Bracy. I'll be brief tonight out of respect of your time, but you know, as always, I'm more than happy to expand upon anything that we discuss tonight. Presented for your consideration is our third budget amendment of the year. We have all good news tonight. I'll give you a quick overview of the budget amendment, give you an update on where we are with CARES Act, and then finish up with answering some questions that were asked this past board meeting about bus driver pay and substitute pay. So the look at the amendment itself. We'll start with our state budget amendment. So the big piece of this state amendment is we moved $17 million of budget out of other programs or PRCs. It's 001, 027, so that's our teacher allotment, our TA allotment, and so on. And we moved it into the restart budget. So the restart budget is for 6 schools that we have in our system that have more flexibility in their spending than what we normally have within our school district. And so this doesn't give us any more money or doesn't change the way we were spending. It's that DPI opens up that transfer process in December for us to be able to move funds around. And so this year DPI allocated $17.5 million, and so we're just moving the money into the pot of money, or move it into PRC 037 for it to be spent. So we also received our last of the large transportation allotments. So transportation funding comes in throughout the year. This was our last large allotment. We'll receive a few more during the year. We also closed out our CRF funds. That's our CARES Act money that was scheduled to expire on December 31st of this past year, 2020. However, on December 27th, we were given an extension. We couldn't count on that extension, so we wrapped up that program with the exception of we still have some devices for students that is still yet to be delivered. And so that should be delivered sometime in February or March. So that's the only outstanding items with our CRF funds. So moving over to our local budget, we have $400,000 set aside to cover athletic activity bus cost. So we discussed at the last board meeting that athletics was going to need help to make it through the year because they were not going to have the revenue that they would normally have in a normal school year. And so one way that we talked about covering that was to cover all the athletic bus costs. So that's a variable cost that is by the mile. So I think, if I remember right, it's $1.50 per mile. And so by covering this cost for the school or for the schools, it provides a little bit of certainty in what they have to pay for. So they no longer have that variable cost of activity buses this year. And so hopefully our students will be able to have a season in all the sports this year. And if so, the athletic departments would not have to worry about their activity bus cost. We also have an additional $85,000 budgeted for charter school growth. That our actual cost or growth in that is going to be a little bit less than $85,000. But full disclosure, a finance officer can over budget something. In other words, we could move $85,000 into a budget line item, and not spend it. And that's okay, but you can never under budget. So if we were to under budget a line item, that would be an automatic audit finding whenever our external auditors came in to review our financials. And so that just gives us a little bit to cover, it's more than enough to cover our total expenses that we are planning to relay to charter schools this year is 3.8 million. So that is a growing number every year. And it did grow with our number of students that are in charters this year. And finally, in our capital budget, there's a few changes there. We have $12,000 allocated to buy 3 cars from the driver's ed program. So even though we already have the cars and they're already titled to us, since they were purchased with state funds, in order for us to use them in a different area outside of driver's ed, we have to cut the state a check for the fair market value for those cars. And so those cars are in better condition than some of our other vehicles that we have in the fleet. And so what we'd like to do would be to pay the $12,000 and put other older vehicles out of commission and use these driver's ed cars within our program. Driver's ed would then in turn use their new state funds this year to buy 3 or more new cars. And they're working on that now to determine how many new vehicles they would be able to purchase. We also needed to bump up the Clayton High School tennis court budgeted amount to cover the lowest bid for that project. I think we moved it up by $40,000. We also had a unusual situation where we had a $30,000 invoice from last year that came in. It was budgeted this past year for, I believe it was the Innovation Academy, if my memory serves me correctly. And the invoice was not paid last year. The vendor notified us in December after almost a year that it was due. And so we quickly budgeted fund balance to cover that invoice. And so that's the highlights of the budget amendment itself. So if there's no questions on the budget amendment, I'll move into some updates about our financials. So our financial position. So we received quite a bit of good news with our CARES Act funding over the holidays here. We once this new stimulus package was passed, our CARES Act funding is going to increase, and the amount that's being floated around of how much would be an increase would be 4 times the amount that we've received in the past. And so if that comes to fruition, since we received $7.4 million in CARES Act funding this past year, or this past calendar year, this new pot of money could be as much as $29 million. So quite a bit more than what we've had in the past. So the timeline on that, from what we heard on a call with DPI this morning, was that it should go to the state board, I believe, in February for action in March. And so we may not actually get the funds until about April, if I understood the timeline correctly. So that's quite a bit of good news there. We don't know what the state funding is going to be for this upcoming year. Typically in recession years, we see some significant cuts in state funding. So hopefully this extra funding that we get from the federal government will more than offset our potential losses that we could have on the state side. Of course, that's unknown. We really have no idea how much what our state budget would look like next year. But the timing for the two should work out pretty well in our favor. One, related to the CARES Act, they did extend the extra leave that employees have, or at least the option. So prior to December 31st, employees had an option to take the Families First Act leave. And so that was mandated across the board. Now they have extended that leave, but it is optional. School districts do not have to offer or continue to offer this type of leave. So we've spoken with Mr. Vetrano and Dr. Bracey, and we tried to look at the cost of what it will cost us to continue to offer this type of leave going forward, because there is a cost to it. And it's very difficult to pin down exactly what that amount is because there's so much overlap between the CARES Act funding and the state board emergency leave policy that is already in place. As best we can tell, it would be a minimal cost to continue to offer that. So unless there is any objection from the board, our recommendation would be to continue to offer that. We do not need a vote on that, but if any board member feels strongly that we might need to discontinue that, we're happy to discuss that.
Mr. Britt, Mr. Sutton, Mr. Malone is saying we do need a vote on that to extend
Oh,
it.
we do? Okay. Okay, that is good to know.
Okay, tell us how that what's the minimal amount?
It's hard to pinpoint exactly the amount that is above and beyond what we would have to offer for the existing emergency leave policy. So it's a state board policy. The leave that's in addition to that, if I read everything correctly and understand it correctly, will be when employees stay home with, let's say, a child that has been quarantined. So a situation where let's use an example of a teacher. A teacher's child has been quarantined, but that teacher hasn't been quarantined, and so that teacher then, using this leave policy, would allow that teacher to use, I believe it is 10 days of leave at full pay, and then up to 10 weeks of pay at 2/3 pay after that first 2 weeks has passed. That's probably oversimplifying it, but that's the extra cost, or that would be. It would be as far as a dollar amount. It was really difficult to pinpoint exactly what it would be because there's so much overlap with the existing emergency leave policy. So I looked at it from a sub cost standpoint to look to see what was the cost for substitutes this past year as a result of certain types of leave, and it was right around $30,000 for the first half of the year. That was extra, or that was sub cost that was related to that type of leave. Director, county health director, to say that the person needs to stay home. So it would apply to someone who actually has COVID or someone who is quarantined for COVID, but the county health director has to say the person needs to stay home. In some districts, the superintendent's office is working with the county health department to either designate one of your nurses to be able to make that determination, or to give you an email or something that might specify under what conditions someone needs to stay home. But if that happens, then the state covers the cost of the leave. And this contagious disease leave has been around forever. It's just all of a sudden with COVID, it's become more important. If you extend the leave, which you can, which is an option, to extend the other leave so that it would
And, right, and if I could just comment, because our department works with employees on leave options, and I'm certainly in favor of extending this leave. So the difference is employers are not required to provide this leave, but I think the federal government gave us the flexibility to continue this leave, and the tax credits continue through March 31st. And I'm glad they did that, especially since we recognize that we're at the peak of, or near the peak, I guess, of this pandemic. And so sort of following the board's decision as well to bring our students back face-to-face, this would just give some benefits to our employees that in the absence of this extension, they might have to use their own leave, or it may be leave without pay if they do not have leave, if they have to be out, let's say, for taking care of their own child, if their child has to be quarantined, or if their school is class is closed or moves to remote because the entire class has to be quarantined. So it just gives more benefits to our employees during this time.
So am I straight that state would pay for for those paid out of state funds? Local, teachers paid out of local, that would rest on the burden of local funds. And federal? Or what does federal do? Because we have teachers, we have staff paid out of federal, correct?
That's correct.
The federal government would pay those. You don't have any idea what percentage of our staff we have out of local?
Mr. Britt would have the, hate to put you on the spot, Stephen, but I know Stephen looks at that data much more carefully than I do, as far as how many of our employees are paid locally versus state versus federal.
And while he's looking for that, I just want to, again, make one more clarification, that the tax credits that he discussed being extended, that is true, but that does you no good, which is private employers, if they make that decision, then they get to extend that part of it.
Correct.
For you, that's where it's complicated on your end, it's complicated, but different on your end, because then you'll be taking up more tax.
And I was just curious.
All right, when you give us the percentage, I want you to give me how much money we're talking about, because I'm not comfortable voting on any extension until I know how much it's gonna cost.
So so to clarify that a little bit, so it depends on what you consider a cost. So what I'll do is I'll give you an example and show you what I mean, why that gets a little bit tricky.
Cost is how much money I pay.
Right. So it depends on what you want to consider a cost. So let's say this is a normal year and you've got 100, there's no coronavirus, you're going to fully employ your teacher throughout the entire year. So let's say that teacher is going to cost you $50,000 that year with benefits. So we'll make it simple. We only have one teacher. And so now we've got the coronavirus. And so now this teacher has to be home for 2 weeks with her child. And so she doesn't have leave. We'll pretend like she doesn't have any other leave that she could take in this case. So just to make it simple. So we had budgeted $50,000 for that teacher anyway. So the only extra cost that it would be above and beyond what we have already budgeted would be the cost of the substitute to cover the class. So then the question becomes, would that substitute have already been needed? So that's where it gets really hard for me to tell you exactly how much will it cost, because let's say you don't do this, there would be savings, because on the state side or any side, it really doesn't matter the funding source, because everything's gonna trickle down to local anyway. So with a couple of exceptions, but the cost is really going to be what extra substitutes would you need, what extra staff would you need, unless you want to look at it how much we could actually save by not offering the extra leave on there. So then that kind of changes I don't know if I'm doing a really good job of explaining that. Does that make sense?
Yeah, your last statement does.
Well, basically, we're still, when a teacher's out, we pay for a sub anyhow. So, we're really sort of in the same situation. Is that correct?
That's my thought. My thought is, I don't think that there's going to be a whole lot of cost to it. We didn't see much cost at all the first half of the year, but it's really difficult to say that there would be no cost at all, or that it would cost $30,000, or to peg a number on it, because like I said, that we've already budgeted to pay for that teacher. That those funds are set aside. Doesn't matter if it's federal, local, or state. But if this hypothetical teacher was out and didn't have leave, we would say, because then that teacher would not earn that full $50,000. So that teacher would earn $50,000 less.
Right, because it would be without pay.
Right.
And we would be approving, if we get a motion to extend it to March 31st, right?
Correct.
And the past expired 12/31/20?
Right. And another thing to note is that extending this does not start a new period for employees. So if an employee exhausted their leave under the Families First Coronavirus Response Act, by extending it, they don't all of a sudden get a new additional leave period. All this does is extend it in case you have a new employee who is in this predicament. They can take advantage of the same leave opportunity that employee prior to December had. It does not start a new window or a new period for employees to say, I exhausted 10 weeks through the Families First, and now January 1, another 10 weeks is now available to me. Once they've exhausted it, that benefit is no longer there.
Okay, I'll entertain a motion to accept our budget amendment number 3, as Mr. Britt has stated.
So move.
Second.
Motion by Mr. Wooten, second by Ms. Andrews. Is that correct?
Zukowski.
I'm sorry, Ms. Zukowski. Thank you. Starting with roll call, Mr. Johnston,
Yes.
Mr. Carroll,
Yes.
Ms. Zukowski,
Yes.
Ms. Sessoms,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0. Mr. Vetrano,
Mr. Sutton, just confirm with Mr. Malone. He said we're gonna need a second motion to extend the leave.
That wasn't part of the.
I make a motion to extend the leave to March 31st, 21.
I have a motion and a second for the extending of the leave.
Yes.
Mr. Johnson,
Yes.
Mr. Carroll,
Yes.
Mr. Zukowski,
Yes.
Ms. Sessoms,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0.
Thank you.
Mr. Vetrano,
Yes, sir, Mr. Chairman. So there are two superintendent recommendations before the board. One is Mr. William Weaver, principal of South Johnston High School, has recommended Mr. David Massengill to serve as an assistant principal at South Johnston High School. That position was vacated by Mr. Ronald James, and so there's a recommendation to employ David Massengill as an assistant principal at South Johnston with a one-year contract. That's the first one. And the second one is the chief academic officer position. There's a recommendation for Dr. Nicholas King to serve in that capacity, and the contract length will align with Dr. Bracy's.
So moved.
Second.
Motion by Ms. Sessoms,
Second.
second by Ms. Zukowski. Mr. Johnson,
Yes.
Mr. Carroll,
Yes.
Ms. Zukowski,
Yes.
Ms. Sessoms,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes.
I vote yes. Motion carries 7-0. At this time, I will need to ask for a motion to amend our agenda to go back into closed session, as well as adding a second personnel item at the end of our closed session that will be back into open session. So at this time, I'll ask for an amendment to the agenda to go back into closed session.
A motion.
Motion by Mr. Wooten, second by Ms. Andrews. Mr. Johnson,
Yes.
Mr. Carroll,
Yes.
Ms. Zukowski,
Yes.
Ms. Sessoms,
Yes.
Ms. Andrews,
Yes.
Mr. Wooten.
Yes. And can we take
I
a
vote yes.
2-minute
Motion
break?
carries 7-0. We'll go back into closed session. 10 minutes left in my tank.
So moved.
Second.
Yeah. Yeah, I'll ask for a motion to go back into closed session for personnel reasons.
So moved.
Second.
Motion by Mr. Wooten, second by Mr. Johnson. Mr. Wooten,
Yes.
Ms. Andrews.
Yes.
Ms. Sessoms,
Yes.
Ms. Zukowski,
Yes.
Mr. Carroll,
Yes.
Johnston.
Yes.
I vote yes. Motion carries 7-0.
We are now back in open session. Do we have a motion to approve the appointment that was discussed in closed session?
Second.
Okay, motion made by Mr. Wooten, seconded by Ms. Zukowski. Any discussion? With no discussion, we'll move to a vote. We'll do a roll call, and we will start with Mr. Wooten.
Yes.
Ms. Andrews?
Yes.
Ms. Zukowski?
Yes.
Mr. Carroll?
Yes.
And Mr. Johnson?
No.
And I vote yes. Mr. Sutton?
Yes.
Okay, the motion carries, 6-1. With no further business, Mr. Carroll has moved that we adjourn the meeting.
Second.
Mr. Johnson seconds. Any discussion? All right, roll call. Mr. Johnson?
Yes.
Mr. Carroll?
Yes.
Ms. Zukowski?
Yes.
Mr. Sutton?
Yes.
Ms. Andrews?
Yes.
Mr. Wooten? And I vote yes. This meeting is adjourned.